She was on her knees scrubbing blood off a hospital floor when the helicopter landed. Not metaphorically. Literally on her knees, yellow rubber gloves, a gray mop bucket beside her, while 3 surgeons stepped over her legs without looking down. The rotor wash from the Black Hawk shook the emergency bay windows. Someone shouted about incoming casualties. Trauma pages fired across every speaker in the building. And the woman scrubbing the floor didn't move. Not because she was slow, not because she was scared, because she had already counted the rotors, estimated the aircraft weight by sound, and knew, before anyone else in that building, exactly how many men were coming off that helicopter and exactly how bad it was going to get. Nobody in Coastal Pines Medical Center knew her real name meant anything. They were about to find out. Before we go any further, if you're new here, hit that subscribe button right now because the story you're about to hear is the kind that doesn't come around often. Give this video a like if you believe the quietest people in the room are sometimes the most dangerous ones. And drop a comment telling me your city and country. I want to see exactly how far this story travels. People are watching from places I never expected, and every comment reminds me why I keep telling these stories. Now, let's go back to that hallway. Her name, the name on her hospital badge, the name her supervisor called when he needed someone to restock the linen closet, was Sera Calloway. 29 years old, blonde hair pulled back so tight it looked almost unkind. Eyes that were an unsettling shade of gray-green, the kind that registered everything in a room before most people had finished blinking. She had worked at Coastal Pines Medical Center in Fort Dillon, North Carolina for 14 months. In that time, she had been assigned to exactly 0 emergency trauma cases. She had been invited to exactly 0 surgical consultations. She had been trusted with exactly 1 independent decision, which was choosing between 2 nearly identical brands of saline flush, and even that had been second-guessed by the charge nurse. What she had been trusted with was the floor, the supply carts, the linen runs, the vital sign checks on patients so stable they were essentially just waiting for discharge paperwork. She was the nurse people called when they needed something carried, something cleaned, or someone to stay with a patient who was fine and boring and going home tomorrow. She was, in the vocabulary of Coastal Pines Medical Center's emergency department, background. Dr. Harlan Voss had made that clear on her first week. He was the trauma director, late 40s, jaw like a highway overpass, the kind of man who wore his reputation like a second badge. He had looked at her intake paperwork, looked at her, and said, with the particular brand of pleasantness that is actually contempt wearing a smile, "We run a tight ER here. Everyone knows their lane. You'll be supporting the floor nursing team. Don't try to do more than that. It confuses patients and slows us down." She had nodded, said, "Understood." She had not argued. She never argued. That was the thing nobody at Coastal Pines could quite explain, in the months after everything happened, how a woman who turned out to be what she was could have spent 14 months being spoken to like a slightly dim housekeeper and never once flinched, never once pushed back, never once let her eyes go cold when someone talked down to her. She just nodded, did the work, went home. The ER night staff had a nickname for her, the kind of nickname that sounds like it could be affectionate but isn't. They called her the Shadow, as in quiet, always there, entirely without substance. Charge nurse Donna Presser, 22 years at the hospital, the kind of institutional authority that doesn't need a title, had summed up the consensus in the break room one Tuesday in October, loud enough that Sera could hear it from the hallway. "She's sweet, but she's not ER. Some nurses just aren't, and that's fine. We need people to keep the floor clean, too." Nobody disagreed. The mop bucket was not a metaphor. It was a literal assignment. The night of January 14th started slow. Coastal Pines ran 2 trauma bays, a 6-bed acute care wing, and a fast-track urgent care corridor that the day shift always left in mild chaos. By 10 p.m., the ER census was low. A broken wrist in Bay 1, a respiratory case in the acute wing, 2 patients in fast-track waiting on results. Sera had spent the first 2 hours of her shift restocking the trauma cart supply closet, which nobody had touched in 3 days, and which was, consequently, a quiet disaster of misplaced packages and expired date stickers. She worked methodically. She always worked methodically. Trauma airways on the top shelf, visible and accessible. IV supplies organized by gauge, not by whatever random order the last person had thrown them in. She did not need to read the labels to know what she was looking at. Her hands moved by a system that had nothing to do with the training she'd received at Coastal Pines. At 10:17 p.m., she was on her knees in the hallway outside Trauma Bay 2, cleaning up a spill that housekeeping had flagged but not yet reached. The overhead fluorescents buzzed. Down the hall, someone was watching a video on their phone too loud. Tinny audio, someone laughing. At 10:22 p.m., the trauma pager system fired. Not the standard pager, the military liaison pager, the one that lived in a locked cradle on the charge desk and had gone off exactly once in the past year, for a training coordination call that turned out to be a scheduling error. Donna Presser grabbed it. Read the screen. Her face went the specific color of someone who has just been handed a problem significantly larger than she prepared for tonight. Incoming military casualties, she said to no one and everyone. Black Hawk transport, ETA 6 minutes. They're saying at least 4 critical. The ER activated. Sera did not stand up yet. She finished wiping the section of floor she was on. Not from slowness, not from indifference, but because leaving a wet floor in a trauma corridor was how people fell during emergencies. And then she stood, stripped her gloves, and moved to the wall. She watched. The trauma team assembled with the particular controlled urgency of people who were good at their jobs but had not seen something like this recently. Residents double-checked equipment. A surgical attending was paged from the on-call room. Donna moved through the space with veteran authority, positioning people, calling for specific supplies. Dr. Harlan Voss arrived 4 minutes later, still tying his scrub top, and the room reorganized itself around him the way rooms do around certain kinds of men. "Who's running point?" he said. "You are," Donna told him. He nodded, satisfied. Looked around the room. His eyes passed over Sera the way they always did. A non-event, a piece of furniture, a presence that didn't require acknowledgement. "Someone get the floor nurse out of the way. I don't want bodies in here who aren't running active roles." One of the junior residents looked at Sera, slightly apologetic. "Can you maybe wait in the supply corridor?" Sera nodded, moved toward the corridor door. She did not go into the supply corridor. She stood just outside the trauma bay entrance, one shoulder against the doorframe, and she waited. The helicopter came in hard. She could hear it from where she stood, not just the rotors, but the pitch of descent, which told her they were coming in fast and not particularly gentle, which meant either the pilot was pushing speed for a reason or there was instability in the aircraft, neither of which was a good sign. The landing rattled the exterior windows. Someone outside shouted. Doors burst open. They came in on 2 gurneys with a third casualty carried between 2 men in tactical gear who had not stopped moving since, from the look of them, before anyone at this hospital had started their shift. All 4 of the military personnel who entered with the casualties were big, controlled, and radiating the specific brand of barely suppressed urgency that Sera recognized as the operational mode of men trained to function under conditions that would stop most people entirely. She clocked the casualties in the first 4 seconds. First gurney, male, mid-30s, gunshot wound to the left lateral chest, oxygen mask in place, skin the color of old paper. Breathing. She could see the chest movement from where she stood, but the rhythm was wrong. Too fast, too shallow, with a subtle asymmetry on the left side that the paramedic running alongside either hadn't caught or hadn't flagged. Second gurney, male, late 20s, blast injuries to both lower extremities, right arm, tourniquet already applied to the right leg. Conscious. Gripping the gurney rail with his left hand hard enough to whiten his knuckles. He was tracking the room with his eyes, not panicking, processing, which told her he had discipline and that his brain was still oxygenated, which was something. Third casualty, carried between 2 men, not on a gurney. Head wound bandaged, but the bandage was soaked through and resaturated. He was unconscious. The men carrying him were trying to maintain neck stability without the proper equipment to do it, which meant they'd made a field decision somewhere that neck injury was less likely than bleed-out risk, which, given the wound location, might be right or might be catastrophically wrong. There was a 4th man, ambulatory, sitting against the wall the moment they got him through the doors, left arm pressed to his side, breathing controlled and deliberate. He was watching everything with eyes that were still sharp, which meant he was hurting and hiding it, which meant he was probably the kind of man who would be in real trouble before he admitted to anyone how bad it was. Sera stayed where she was. She had done the math. She had identified the sequence of priorities. She was not a doctor. She was the floor nurse. She was supposed to be in the supply corridor. She stayed where she was and watched the trauma team work. Voss took the first gurney, the chest wound, because that was the highest acuity presentation and because Voss was a man who went toward cameras and severity with equal instinct. He ordered a chest X-ray. He called for a large-bore IV and a type and cross-match. He spoke loudly and moved efficiently, and the residents around him responded like a tuned machine. He did not look at the breathing pattern. Sera's jaw tightened, one small, invisible movement. A second attending, Dr. Priya Okafor, younger than Voss, sharper in Sera's private assessment, though she'd never said that to anyone, took the blast injury case. She worked quickly, checked the tourniquet, called for imaging, pushed fluids. She was good. Sera had watched her work before, from hallways, from the edge of rooms, from the supply doorway. Okafor was the kind of doctor who actually listened to the information the body was giving instead of waiting for the machines to translate it. The third casualty, head wound, was placed in Bay 2. The fourth man, the one sitting against the wall, was eventually reached by a junior resident who knelt beside him and started an intake assessment. The military escort, a captain in tactical gear, dark-haired, early 40s, with the bearing of someone who had spent significant portions of his adult life in places with no cell service and high casualty rates, was standing near the entrance and watching everything with the expression of a man performing calculations he did not like the outcome of. His name tape read Del Vecchio. Donna Presser approached him. "Can you tell us what we're dealing with? The briefing we got was minimal." "Classified operation," Del Vecchio said. His voice was flat. Not unfriendly, just operating on a frequency that did not have room for softness right now. "What I can tell you is that the blast was not a standard IED profile. The injuries may not present the way your team expects." Donna nodded and went back to the floor. Sera had heard every word. She also heard, and this was the thing that moved her off the wall, the shift in the ventilator alarm attached to the first gurney. Not a full alarm. A subtle change in the waveform tone that most people in the room were too busy to catch, the kind of thing that sounds like equipment noise until it doesn't. She walked into the trauma bay. "His trachea is deviating," she said. The room did not stop. Nobody heard her. She moved to the head of the gurney. She said it again, louder. "His trachea is deviating to the right. He has a tension pneumothorax." Voss turned around. The look on his face was not surprise. It was the specific irritation of a man who has been interrupted by someone who was told to wait in the supply corridor. "Calloway." He said her name like it was an error. "What are you doing in here?" "His left lung isn't moving," she said. She did not raise her voice. She did not perform. She just said it, flat and certain, the way you say things you are sure of. The asymmetry has been there since he came through the door. If you chest X-ray him instead of decompress him right now, he's going to arrest before the image is processed. I need you to step back. Dr. Voss, step back. He pointed at the door. You are not cleared for this room. Get out. A beat of silence, the kind that has weight. Sera looked at the man on the gurney. His lips were going blue at the edges. His oxygen saturation, which had been holding at 88, dropped to 85 on the monitor. Then 83. She stepped back. She did not go through the door. She watched Voss turn back to his patient, watched him assess, watched him order the X-ray again. She watched the attending radiology tech position the portable unit. She watched the oxygen sat drop to 80. Then the monitor alarm changed pitch, not the subtle change from before. The full alarm, the kind that means the body has stopped negotiating. The SEAL operator on the first gurney went into cardiac arrest at 10:51 p.m. The room detonated into controlled chaos. Voss called for the crash cart. A resident started compressions. Someone pulled the crash cart, and someone else nearly knocked over the portable X-ray unit getting around it. Okafor looked up from Bay 2, assessed the situation in 2 seconds, kept working on her own patient because that was the right call. Del Vecchio, from the doorway, said nothing. But his eyes, which had been moving across the room the entire time, found Sera. Stayed there. She was already moving. She didn't ask permission this time. She crossed the bay in 4 steps, reached past the resident doing compressions, and said in a voice that carried without being a shout, I need a 14-gauge needle, second intercostal space, mid-clavicular, right now. The resident doing compressions blinked at her. "Now," she said. Same tone. No question in it. The scrub tech beside her moved on instinct, passed her the needle. Voss said, "What the hell do you think?" The needle went in. The hiss of air was audible across the bay. The decompression happened immediately. The trapped air escaping the pleural space, the pressure releasing, the collapsed lung beginning to re-expand. The monitor, which had flatlined for 11 seconds, showed a return of rhythm. Not perfect, not stable, but a rhythm. The resident doing compressions stopped, stared at the monitor, then stared at Sera. The bay was very quiet. Sera withdrew the needle, reached for a flutter valve without being handed one because she already knew where they were on the crash cart. She had restocked this cart herself, twice this month. She secured the valve, checked the dressing, looked at the saturation monitor. 79, 81 volt, 84, climbing. She stepped back. Voss was staring at her with an expression she had never seen on his face before. It was not gratitude. It was not respect. It was something more complicated and less comfortable. The expression of a man recalibrating a reality he had organized very carefully. "You need to explain yourself," he said. "Not right now," she told him. "The third casualty in Bay 2 has a scalp bleed that's been resaturating his bandage for the last 8 minutes. If that wound has a subdural component, he needs a head CT in the next 10 minutes, not 30. She looked at the man on the first gurney. Stable, oxygenating, rhythm holding. He needs a chest tube now that the lung is decompressed. If you want to discuss my credentials, we can do that after." She turned and walked toward Bay 2. Nobody stopped her. What happened over the next 40 minutes was the thing that nobody at Coastal Pines Medical Center could quite put into a coherent narrative afterward, because it did not fit the story they had been telling about Sera Calloway for 14 months. She moved through the trauma bay with a precision that had nothing to do with the careful, deferential movements they had watched from her all year. Not aggressive, she never raised her voice, never shoved anyone aside, never performed for the room. But she moved like someone who had done this in worse conditions. Like someone who had done this in the dark, in the rain, with fewer supplies and fewer hands, and a clock that was actively running out. She identified the subdural bleed risk on the third casualty and flagged the specific symptom combination, pupil asymmetry, subtle posturing, the pattern of impact in the wound, that indicated the need for immediate neurosurgery consultation rather than a wait-and-scan approach. She was right. The neurosurgeon who arrived 20 minutes later confirmed it immediately. She identified that the blast injury patient, second gurney, had a secondary injury pattern consistent with a type of overpressure trauma that did not show on standard imaging and required specific assessment. She talked Okafor through the assessment protocol in 3 sentences. Okafor, to her credit, listened, ran the assessment, and found the pneumatic contusion to the right lung that would have been missed until it became a problem in an hour. She managed the 4th man, the one who had been sitting against the wall performing controlled breathing, with a conversation that lasted approximately 90 seconds and resulted in him allowing his ribs to be assessed. 3 fractures. One of them close enough to the liver margin that repositioning him incorrectly could have caused a laceration. Sera positioned him herself, with the junior resident assisting, before they moved him. Captain Del Vecchio watched all of it. He had stopped performing his own assessment of the situation approximately 20 minutes in because the situation no longer required his assessment. It was being handled. He stood near the trauma bay entrance with his arms crossed and his eyes tracking Sera specifically. At 11:34 p.m., when all 4 operators were stabilized, all 4, not 3, not 2, all 4, which was apparently not what anyone had predicted based on the initial casualty presentation, Del Vecchio approached her. She was washing her hands at the bay sink. There was blood on her left forearm that wasn't hers, and she was cleaning it with the methodical focus she brought to everything. "Calloway," he said. She looked up. "That's not your name," he said. It wasn't a question. She held his gaze for a moment, then she went back to washing her hands. "I need to make a call," he said. "I need to know who I'm talking to before I make it." "You don't need to know that," she said. "Your men are stable. That's what matters tonight. You performed a needle decompression under fire from your own medical director and identified a blast pattern that's classified to a specific operational context." His voice was still flat, still professional, but something underneath it had shifted. That's not nursing school knowledge. People know things from a lot of sources, she said. Not those things, he said. Not that specific. She dried her hands, looked at him. Make your call, she said. I have a floor to clean. She picked up the mop from where she had left it, at the entrance to the trauma bay, and she walked back toward the hallway. Del Vecchio watched her go. Then he took out his phone. At 11:52 p.m., Voss found her in the supply corridor. She was reorganizing the crash cart supplies that had been scrambled during the resuscitation, putting things back in their places, checking expirations, making the cart functional again for the next emergency. The overhead light in the corridor was slightly too bright and slightly too humming, and she had been working in it for 10 minutes without noticing either. I need you to come with me, Voss said. She looked up. His expression had cycled through several phases in the past hour, and was currently landed somewhere between controlled anger and what she suspected was genuine uncertainty, which was not an emotion Harlan Voss typically wore in visible places. I need to understand what happened in there, he said. I told you what happened. You had a tension pneumothorax that was about to kill your patient. You performed an unauthorized procedure in my trauma bay. I performed a needle decompression on a man who was in cardiac arrest because the pressure in his chest was killing him, she said. She was not loud about it. She was just exact. You can write me up. You can file a complaint with the nursing board. You can do whatever you need to do. But we can do that tomorrow, because right now I still have 6 hours left on my shift, and I have 2 patients in the acute wing whose vitals haven't been checked in 40 minutes. Voss stared at her. Who are you? He said. It came out differently than he probably intended. Not an accusation, almost a real question. She held his look for a moment. I'm the floor nurse, she said. I'll have the supply cart restocked by 1 a.m. She turned back to the cart. Voss stood in the doorway for another few seconds. Then he left. Sera continued sorting supplies. Her hands were steady. They were always steady. That was not something she had practiced. It was something she had learned to stop fighting, in a time and a place she did not think about inside this building. Her radio crackled. Donna Presser, from the charge desk. Calloway. Call on the desk. Military liaison. They said it's urgent. She clipped the last supply package into place, took a breath, set down the mop. She walked toward the charge desk, and she did not look like a floor nurse anymore. Not in the way she moved, not in the set of her shoulders, not in the particular quality of stillness she carried that was the exact opposite of the timid, deferential shuffle everyone here had spent 14 months cataloging as her natural state. She looked like someone who had been waiting for a specific phone call for a long time, and was not entirely surprised it had arrived tonight. The phone on the charge desk had a red light blinking. She picked it up. Calloway, she said. A pause on the other end. Then a voice she had not heard in 3 years. A voice that belonged to a chain of command that existed outside every civilian credential and every hospital hierarchy in this building, said 4 words. We need to talk. The red light kept blinking. In the trauma bay behind her, 4 men who should not have survived tonight were breathing. The voice on the phone belonged to Commander Alec Rourke. She knew that before he said his name because she knew the cadence, the specific way he compressed syllables when he was operating under time pressure, which was, in her experience, most of the time. Rourke was not a man who called to chat. In 3 years of working under his command, she could count the number of non-essential conversations they'd had on one hand with fingers left over. Rourke, she said. Not a greeting, a confirmation. You picked up, he said. Good. Good. That means Del Vecchio's assessment was accurate. What assessment? That you were still you. A pause. The kind that meant he was in a room with other people and choosing his words accordingly. We've been monitoring the casualty transport. We have a debrief situation developing that involves the men who came through your ER tonight, and there are elements of their mission profile that... Rourke. She kept her voice low. The charge desk was 30 feet from the nursing station, and Donna Presser had the particular talent of appearing at inconvenient moments. I left. That was the arrangement. The arrangement assumed a stable operational environment. Nothing about this is my operational environment anymore. Calloway. His voice dropped half a register. 4 men just survived because you were in that building. That's not coincidence, and we both know it. I need 24 hours. She looked down at the charge desk. The red light on the phone had stopped blinking. Somewhere behind her, a monitor beeped steadily. One of the operators, still in the trauma bay, being watched by a resident who had no idea what kind of man he was watching. 24 hours for what? She said. For us to get there, he said. Don't go anywhere. The line went dead. She held the receiver for a moment, then set it down. Donna Presser was, in fact, standing 6 feet away, holding a tablet and pretending to review patient notes with the focused intensity of someone who was absolutely listening. Everything okay? Donna asked, not looking up. Fine, Sera said. Routine liaison follow-up. Donna nodded slowly, the way people nod when they are storing information for later consideration. Dr. Voss wants to see you in his office at the end of your shift. I'll be there, Sera said, and walked back toward the acute wing to check on her patients. Her hands were still steady. The rest of her was doing calculations she hadn't needed to run in a long time. The rest of the shift passed with the particular quality of a held breath. The 4 operators remained in the building, 2 moved to the surgical ICU, 1 to a monitored step-down bed, and the 4th, the man with the fractured ribs, admitted for observation in a room at the end of the acute care hall. The military escort, Del Vecchio and 2 others, did not leave. They repositioned to a family waiting area near the SICU entrance and stayed there, which the night nursing staff found unsettling in the specific way that large, quiet, armed men in a hospital hallway tend to be unsettling. Sera did her rounds. She checked vitals. She changed a dressing on a post-surgical patient in room 4 who was doing fine and wanted to talk, so she let him talk. He was 73 years old and had strong opinions about the state of American infrastructure that she gathered he'd been developing since approximately 1987. She listened. She made the appropriate sounds. Her mind was moving on a parallel track that had nothing to do with highway funding. At 2:15 a.m., she passed the acute care hallway and slowed. The room at the end, the 4th operator, ribs, observation, had its light on. The door was cracked. She could see, through the gap, the man sitting up in bed. Not asleep. Not trying to sleep. Sitting with his back against the headboard and his good arm resting across his knee, looking at the wall with the focused patience of someone who had spent a lot of time waiting in uncomfortable situations and learned to be still while doing it. He was maybe 35. Dark hair, cut close. A jaw that had, at some recent point, been on the receiving end of something hard. His hospital gown was on wrong. She could see from the hallway that he'd put it on backwards, probably because navigating the ties one-handed was annoying, and he hadn't asked anyone to help him, probably because asking for help wasn't a reflex he'd developed. She pushed the door open. He looked at her immediately. Not startled. He'd heard her approach, she'd bet on it, just tracking. Vitals check, she said. I just had one 40 minutes ago. I know, I'm doing another one. She moved to the monitor, checked the display, noted the numbers. Everything in range. The controlled breathing from earlier had done its job. His respiratory rate was managed, his O2 sat was holding without supplemental oxygen, which given 3 rib fractures was better than expected. You're the one who told them about my ribs, he said. I mentioned the positioning concern, yes. Before that, you were watching when we came in. She glanced at him. He was watching her with the particular quality of attention she recognized from Del Vecchio, from Rourke, from every man she'd spent 3 years working alongside. The attention of someone trained to extract information from what wasn't being said. I was in the hallway, she said. You clocked the injuries before the paramedics finished their handoff. She made a note on the tablet. You should sleep. Fractured ribs are significantly more painful on day 2 than day 1, and right now the adrenaline is still doing some of the work for you. That's a deflection, he said. That's a clinical recommendation, she said. They're not mutually exclusive. A beat. He almost smiled. Not quite. It was more like the ghost of a smile, the shape one would make if it fully formed. What's your name? He said. It's on the badge. I know what the badge says. He looked at her steadily. I'm asking what your name is. She held his gaze for a moment, then she capped the pen, set it on the tablet. Calloway, she said. Get some sleep. She left before he could say anything else. The meeting with Voss at end of shift was at 6 a.m. in his office on the 3rd floor, which she had never been inside before. It was the kind of office that communicated its inhabitants' self-assessment through square footage and the number of framed credentials on the wall. Voss had 7. She counted them while he settled into his chair and organized whatever he'd decided to say. "Sit down," he said. "I'll stand," she said. "I have to be out of here by 6:30. He studied her. In the shift lighting of his office, he looked tireder than usual. The kind of tired that comes not from physical exertion, but from a long night of rearranging an understanding you'd held very comfortably. "You saved his life," he said. It cost him something to say it. She could tell by the slight tension around his mouth, the way he delivered it with the cadence of a man clearing a debt rather than offering a compliment. "The needle decompression was indicated," she said. "Any trained clinician would have—" "I didn't," he said. Silence. "No," she agreed. "You didn't." More silence. He picked up a pen, set it down. "Where did you train?" "My credentials are on file with HR." "I've seen your HR file. Bachelor's of Science in Nursing, clinical rotation at a regional hospital in Virginia, 2 years of floor nursing before you came here." He looked at her. "That file does not explain last night." "My file is accurate." "Don't do that," he said. His voice went flat. "Don't manage me. I've been practicing medicine for 22 years. I know what a trained surgeon looks like, and I know what a nurse who restocked supply carts for a year looks like. And last night I watched someone who was neither of those things." He leaned forward. "You identified a blast injury pattern that one of my attendings had never seen. You ran a decompression like you've done it 100 times. You gave my team orders and they followed them. And the reason they followed them is because the way you gave them made it physically difficult not to." He stopped. "What are you actually doing in my hospital?" She looked at him for a long moment. "I'm the floor nurse," she said, "and I need to go." She left him sitting at his desk with the pen in his hand again and an expression she couldn't quite name. Not anger anymore, or not only anger. Something closer to the particular discomfort of a man who had been wrong in a visible way and was still working out what to do about that. She took the stairs down. In the stairwell, alone, she let herself stop for exactly 10 seconds. She put one hand against the concrete wall and breathed. Not in any technique-based way, just breathed. The way you do when you've been holding something tightly for a long time and need to acknowledge privately that your grip is getting tired. Then she pushed through the door and went to get her bag. She did not go home. She drove to the parking lot of a diner 3 miles from the hospital, ordered coffee she didn't particularly want, and sat in a booth by the window where she could see both the entrance and her car. The diner was the kind of place that had been the same diner for 30 years. Same laminate tabletops, same pie case with 3 kinds of pie, and a rotation that had not changed in recent memory. Same ambient smell of coffee and grill, and something indefinably comforting that was probably just consistency. She drank the coffee. She looked at her phone. Rourke had sent a text at 4 a.m. that said only, "ETA 1400, stay available." She had not responded. She was considering not responding. The problem with Rourke's 24 hours was not that she didn't understand why he wanted it. She understood exactly why he wanted it. The problem was that 24 hours had a way of becoming a conversation, and a conversation had a way of becoming a request, and she had been very precise about not being available for requests anymore. She had reasons for that. Reasons she had organized carefully into a structure that made sense and held together and justified the 14 months of mopping floors and restocking carts and being spoken to like a piece of furniture by Harlan Voss, while more complicated feelings sorted themselves into something manageable. The structure was still there. She was just aware this morning that it had some new stress fractures in it. Her coffee went cold. She ordered another one. At 8:17 a.m. her phone rang. Unknown number, but the area code was one she recognized from a different chapter of her life. She answered. "Calloway." "Sera." Not Rourke. A woman's voice, careful and professional. "This is Deputy Director Harmon's office. We need to speak with you about the incident at Coastal Pines last night. Are you in a secure location?" She looked around the diner. An elderly couple sharing a crossword. A man in paint-stained work clothes reading something on his phone. The waitress behind the counter, refilling syrup dispensers with the focused energy of someone who had been on shift since 5. "No," she said. "Can you get to one?" "Probably not by whatever timeline you're working with." A pause. Papers shuffling. "There are individuals en route to Fort Dillon who will want to speak with you directly. We'd like you to make yourself available." "I've already had that conversation with Rourke." This is above Rourke's clearance level. She set her coffee mug down. How far above? She said. Significantly, the voice said. And then, with the careful precision of someone delivering information they know will land hard, Admiral Prescott is leading the debrief. The name hit her in the chest. Not like a fist, more like recognition. The specific weight of a name attached to a specific series of events she had spent the better part of 3 years not thinking about in any organized way. I see, she said. He specifically requested you by… A pause that sounded like the woman was deciding something. By your operational designation, not your civilian name. I don't have an operational designation anymore. With respect, Miss Calloway, Admiral Prescott's position is that certain designations don't have an expiration date. She looked out the window. A pickup truck pulled into the diner lot. 2 men got out, construction workers, from the look of it, arguing cheerfully about something as they walked to the entrance. I'll be available, she said, but I'm not coming in. If the Admiral wants to talk, he comes to me. Another pause, longer this time. I'll relay that. You do that, she said, and ended the call. She finished her second coffee. She left a cash tip that was more than the bill and drove back to her apartment, which was a 3rd-floor walk-up 8 minutes from the hospital with a parking situation that was technically adequate and practically annoying. She had lived there for 14 months. It looked still like someone had moved in with the intention of unpacking properly later and then never gotten around to it. Not messy, just minimal. A couch, a table, books she had actually read. A kitchen that was used for cooking because she cooked, not because she was performing domesticity. She showered, changed, sat on the couch with her second phone, the one that only had 3 contacts in it and that she paid for in cash at a carrier store 2 towns over, and looked at the screen. She had not used this phone in 4 months. She used it now. She sent a single message to a contact saved only as R. They're coming, Prescott. The response came back in 40 seconds. I know, don't let them push you. She looked at that for a moment. Then she put the phone down and went to make breakfast, because she hadn't eaten since before her shift, and she was going to need to be functional today, and being functional required food, and that was a manageable problem, which was more than she could say for the rest of them. Admiral Warren Prescott arrived at Coastal Pines Medical Center at 2:07 p.m., which meant Rourke's 1400 estimate had been accurate to within 7 minutes, which was honestly better than she'd expected. She was sitting in the hospital's family consultation room on the 2nd floor when they brought him in, a room that was designed for delivering bad news and therefore featured soft lighting and chairs that were slightly too comfortable, presumably on the theory that bad news was easier to receive when your back was supported. She had chosen this room deliberately. Neutral ground, inside the building, close enough to the SICU that she had a legitimate reason to be here. Prescott walked in with 2 aides and Delvecchio and Rourke, which was more people than she'd expected, and then the aides took positions outside the door, and it was just the 4 of them. He was 62 years old. She had not seen him in 3 years, and he looked like those 3 years had been eventful. Heavier around the jaw, lighter on top. The bearing was exactly the same. The military posture was not something that changed. It was something that became more fixed with time until it was structural. He looked at her the way people look at things they thought were resolved. Calloway, he said. Admiral, she said. He sat down across from her. Rourke and Delvecchio took positions to the side. Not seated, not exactly standing at attention, occupying that middle register that meant they were present but understood this conversation wasn't theirs. I'm going to be direct, Prescott said. Please, she said. The 4 men who came through here last night were on a classified operation that went sideways in ways we're still mapping. The specifics aren't something I can put in this room. He held her gaze. What I can tell you is that those 4 men were not supposed to survive that transport. The injuries they presented with, based on the scenario our medical team was briefed on, should have resulted in at minimum 2 fatalities by the time they reached a facility. Your medical team was briefed wrong, she said. I know that. I also know why they survived. He paused. Captain Delvecchio's report from last night was detailed. She looked at Delvecchio briefly. He was looking at the wall with the studied neutrality of a man submitting a report and then removing himself from the consequences of it. I did my job, she said. You performed emergency surgical intervention, directed a trauma team through a protocol that isn't in any civilian medical textbook, and correctly identified a blast injury pattern that requires a classified briefing to even know exists. Prescott's voice was even, not accusatory, just precise. That's not nursing. That's not what you're credentialed for here. Nobody died, she said. No, he agreed. Nobody died, which is why we're having this conversation instead of a different one. He leaned forward slightly. I need to know how much your cover is compromised. She looked at him. It's compromised, she said. My medical director spent 40 minutes last night trying to figure out who I actually am. We can manage that. Can you? She said. Not a question exactly. The particular non-question of someone who has seen what managing things looks like in practice. Voss has been contacted by our civilian liaison office this morning, Rourke said from the side of the room. He's been read in on the general framework, national security context, need-to-know parameters. He's been asked to maintain discretion. She turned to look at Rourke. He had the grace to look slightly uncomfortable, which meant he understood how that landed. You read in Harlan Voss, she said. Selectively, Rourke said. He's going to use it, she said, not against me, for himself. He'll hold it, the fact that he knows something, and he'll use it to rebuild whatever the last 12 hours damaged in his sense of how this hospital works. That's who he is. We're aware of Dr. Voss, Prescott said. Then you know I'm right. Prescott was quiet for a moment. Outside the room, through the door, she could hear the muffled sounds of a hospital in midday rhythm. Carts, voices, the PA system calling for someone in housekeeping. There's a second issue, he said. The operation those 4 men were on. The one that went wrong. There's a component we're still trying to understand. The injury profile, the specific way the engagement deteriorated, points to a breach in operational intelligence. He watched her face. Someone knew they were coming. The room changed quality slightly. She looked at Prescott. You think there's a leak? We think it's possible. In what chain? That's what we're trying to determine. He folded his hands on the table. Which is why your continued presence in this facility for the next several days is something we'd like to request. She had known this was coming. She had known it since 11:52 last night, standing in the supply corridor, sorting crash cart inventory. Possibly she had known it since the helicopter landed. You want me to stay in place, she said. We want you to continue your current role. Maintain your cover. Stay proximate to the casualties. You have medical justification for access, and the nursing staff's existing view of you actually functions as an asset here. Nobody's going to assume the floor nurse is an intelligence-adjacent operative. Nobody assumed that for 14 months, she said. And nobody assumed that last night until I decompressed someone's lung in front of 12 people. The immediate staff will be managed, Prescott said. You can't manage Donna Presser, she said. Del Vecchio made a sound that was not quite a laugh and immediately stopped making it. Prescott's expression shifted slightly. Not a smile, more like the recognition of a point accurately made. We're not asking you to rebuild the cover from scratch. We're asking you to maintain proximity for 72 hours while our team works the intelligence angle. And my medical director? Will be managed, Prescott said. I want that in writing, she said. You know I can't put this in writing. Then I want Rourke's word, in this room, that Voss is not going to use whatever you told him this morning to make my next 72 hours more complicated than they need to be. Rourke looked at her. You have my word. She believed him. Rourke's word was not a thing she had ever found reason to doubt, which was one of approximately 3 things about the organization she'd left that she thought about with anything adjacent to warmth. 72 hours, she said. I go back on shift tonight. I maintain my current role. I don't perform any further medical interventions outside my documented scope unless there's an immediate life threat, because I cannot have another incident like last night before you've managed the fallout from the first one. Agreed, Prescott said. And the men in the SICU, she paused. The one with the chest tube. He needs to be watched for reaccumulation. The attending on tonight's shift hasn't seen a traumatic pneumothorax with blast component before. I need someone to make sure the night attending actually reads the consult notes. Prescott glanced at Rourke. I'll handle it, Rourke said, meaning he would handle it in whatever way Rourke handled things, which typically involved a phone call to someone who then handled it themselves while believing it was their own idea. She nodded. One more thing, she said. What? Prescott said. The fourth man, ribs, room at the end of the acute hall. She stopped. Specialist Marcus Teller, Delvecchio said from the wall. He knows something's off about my cover, she said. He's sharp. Whatever you brief the others, he'll see through it. He's not cleared for... I know what he's cleared for, she said. I'm telling you he'll see through it anyway. So if you're going to brief him closer to the truth than you're briefing the others. Otherwise, he's going to spend the next 72 hours quietly figuring it out himself. And that's going to cause more problems than just telling him something real. Delvecchio was very still. Prescott looked at her. How do you know that about him? Because I watched him for 4 minutes at 2 a.m., she said. He put his hospital gown on backwards rather than ask for help. He was tracking the room while running 3 fractured ribs and the adrenaline drop from a combat engagement. And when I told him to sleep, he identified the deflection in real time and called it out. And that tells me he's paying attention in the way people pay attention when it matters. She stood up. That's my assessment. Do what you want with it. She picked up her bag. Calloway, Prescott said. She stopped. I know this isn't what you wanted, he said. She looked at him. Prescott, to his credit, held the look without deflecting. No, she said. It isn't. She left. She went back on shift at 7 p.m. The evening transition was the same as it always was. The day shift handing off to evenings with the particular efficiency of people who are tired and want to leave. Donna Presser, who worked an inexplicable schedule that seemed to require her to be in the hospital at all hours, gave Sera a look when she came through the nursing station that communicated, without words, that several things had happened today and they would be discussed when the moment was right. The moment was not right yet. Sera signed in, picked up her patient list, and went to work. The acute wing was quiet. The SICU cases were being managed by the ICU nursing team, which was appropriate. She had legitimate reasons to check on the transfer patients, but not to be primary caregiver. She made herself visible in the acute wing, did her work, and kept her movements normal. At 8:45 p.m., she passed the room at the end of the hall. The light was on again. She did not stop. She kept walking, made it to the nursing station, picked up a tablet, and turned around. Donna Presser was watching her. Room 17 wants a pillow adjustment, Donna said, and room 22 hasn't eaten much. I'll check on 22, Sera said. He's asking for you, Donna said, with the particular precision of someone delivering information they know is pointed. The patient in room 17, he asked for you specifically. Sera looked at her. Donna looked back with an expression of absolute professional neutrality that was doing a great deal of work. I'll see to him, Sera said. She walked to room 17. Teller was sitting the same way he'd been sitting at 2 in the morning, back against the headboard, one arm across his knee, utterly alert in the way of someone who had managed his own discomfort into a manageable state through sheer organizational stubbornness. The hospital gown was still on backwards. Somebody had apparently tried to give him a second one to layer over the first, and he'd declined, based on the folded gown sitting untouched on the side table. You asked for me, she said. I did, he said. He watched her cross the room. Someone came through here this afternoon. 2 men in suits who were not hospital administrators regardless of what their lanyards said. They talked to the night nurse for about 20 minutes. Then they came in here. She kept her face neutral. Okay. They told me there was a national security component to my treatment and that I should direct any questions about my care to a designated medical liaison who would be assigned to this floor. He paused. Then they described the medical liaison. She waited. They described you, he said. Blonde nurse, 3rd floor, goes by Calloway. She looked at him. They didn't use your name, he said. They described you. Because apparently your name is something they're being careful about. He tilted his head slightly. So I'm asking you directly, since they weren't going to answer it, and I've been sitting here for 6 hours with 3 broken ribs and not a lot of other entertainment. Who are you? She looked at him for a long moment. Then she pulled the chair from the corner, turned it around, and sat down. I'm your nurse, she said, and I'm going to check your pain scale, and then I'm going to check your breathing, and then I'm going to tell you that the men who came through here this afternoon are trying to help you. Even if the way they help people is annoying and involves a lot of suits and careful language. That's still not an answer, he said. No, she said. It's not. She reached for the monitoring tablet. He watched her. You knew about the ribs before the scan, he said. You knew about the positioning risk before the transport, and you knew... He stopped, recalibrated. You move like someone who's done this in the field. She looked up from the tablet. Pain scale, she said. 1 to 10. 6, he said, without hesitation, which meant it was probably an 8, and he'd decided 6 was an acceptable number to admit to. She made the note, stood up. I'll get you something for the pain, she said. Calloway, he said. She stopped at the door. I'm not going to stop asking, he said. Not a threat, just a fact, delivered with the matter-of-fact certainty of someone who meant it and wanted her to know they meant it. I know, she said. She stepped into the hallway and nearly walked into Donna Presser, who was standing outside the door with the expression of a woman who had been outside that door long enough to have heard more than she should have. The two of them looked at each other. Down the hall, the elevator dinged. A set of doors opened. 2 men in suits, not the same ones who'd visited this afternoon, different suits, different build, walked out and looked toward the nursing station with the particular directional certainty of people who had a destination in mind. Behind them, a third figure stepped off the elevator. Not a suit, a uniform, 4 stars. Sera went very still. Admiral Prescott had said 72 hours. He had said his team was working the intelligence angle. He had said he would manage it. He had not said he was coming back tonight. He had not said he would be bringing someone with him whose rank made Prescott look like he was mid-career. The figure in the uniform scanned the hallway, found her with the accuracy of someone who had been given a specific description, and held the look for exactly 2 seconds before moving toward the nursing station. Donna Presser made a sound beside Sera that was not a word, more like the intake of breath that precedes one. Do you know who that is? Donna said, in a voice that was working hard to stay quiet. Sera knew who that was. She had last seen him at a classified debrief in a building that did not officially exist, 18 months before she took the floor nursing job at Coastal Pines Medical Center, when he had shaken her hand and told her that her service record would be sealed and that she could go live whatever life she wanted, and that her country was grateful. Her country, apparently, was done being grateful and had moved on to needing things again. Calloway, Donna said. That's the Joint Chiefs. I know who it is, Sera said. She did not walk toward him. That was the first decision, and she made it in the half-second between recognition and movement, staying where she was, outside room 17, letting him cross the distance, because closing the gap herself would communicate something she wasn't ready to communicate yet. Control of a situation starts with control of your own position in it. That was not a thing she'd read in a book. That was a thing that had been true often enough in enough different contexts that it had become reflex. General Mort Ashford walked the length of the acute hall with the unhurried pace of a man who had never in his adult life needed to hurry because rooms reorganized themselves around his presence before he arrived. 4 stars. Army, not Navy, which meant this was not a Navy chain of command visit. This was something that had escalated sideways into a different architecture of authority entirely. He was 67, compact, with close-cropped white hair, and the face of someone who had been making decisions with large consequences for so long that the weight of it had become simply his expression. He stopped in front of her. He looked at her for a moment the way people look at things that don't match the file. Specialist Calloway, he said. She kept her voice level. That designation hasn't been active for 3 years, sir. Humor me, he said, and then, without preamble, walk with me. He did not take her to the consultation room. He took her to the stairwell, the same stairwell she'd stood in alone at 6 that morning, which told her he wanted the conversation contained and off the floor where Donna Presser existed. The 2 suited aides took positions at the stairwell entrance. Prescott came in behind them and closed the door. Ashford stood 2 steps up, which put him and Sera at approximately eye level, which she suspected was deliberate. I'm going to assume, he said, that Prescott gave you the general framework this afternoon. He gave me his version of it, she said. Ashford's mouth moved in something that wasn't quite a smile. Then I'll give you mine. He folded his hands behind his back. The operation those 4 men were on was a direct action mission against a procurement network. Specifically, a network that has been systematically supplying falsified military medical equipment specifications to contracts across 3 branches of service. Substandard materials presented as meeting operational grade. We've been tracking it for 16 months. She processed that. Medical equipment, trauma kits, surgical supplies, emergency airway materials, the kind of equipment that gets used when someone is shot in a place where a hospital doesn't exist. He held her gaze. The kind of equipment you have direct personal knowledge of the consequences of. The stairwell was concrete and slightly too cold, and had the quality of a space where sound went to be contained. She kept her breathing even. The mission targeted a specific node in the procurement chain, Ashford continued. It was supposed to be a clean intelligence extraction, get the documentation, identify the domestic source. It was not supposed to result in 4 men in a hospital. He paused, which means the target knew they were coming. Prescott mentioned a potential breach, she said. Prescott was being careful with language. Ashford's voice did not change, but something in the delivery did. The particular quality of a man reaching the part of the briefing that matters. We have a confirmed leak. We identified it 6 hours ago. It runs through a civilian contractor with access to operational scheduling for special operations medical support. She went still. Medical support, she said. The contractor had access to medevac routing, hospital liaison protocols, the specific chain that determines which facility receives casualties from which operational theater. He watched her face. Which means whoever burned that mission knew not just that the team was going out, they knew where the team would go if they got hurt. She understood what he was telling her. She understood it completely, and she ran it forward 3 steps before she said anything. They knew the team was coming here, she said. We believe so. Which means, she stopped, started again. If someone wanted those 4 men not to survive transport, knowing the destination facility in advance would be, yes, Ashford said. The stairwell was very quiet. You think there's someone in this hospital, she said. We think it's possible. He held her look without flinching. We think it's more than possible. The injury outcomes last night should have been fatal, based on the medical support those men were supposed to receive. If you hadn't been here, and if you hadn't done what you did, the probability of at least 2 of those men surviving long enough for a second intervention was low, she said. Below 20%, based on the resources and response we were tracking on the ground, he said. Which raises a question. She waited. Did anyone at this facility know the team was being transported here before the medevac pager activated? He said. She looked at him. You're asking me if I know. I'm asking you if you noticed anything. She thought back. The timeline, the pager going off at 10:22, the trauma team activating, Voss arriving 4 minutes later. Not unusual. He lived close. He'd been on call. Donna Presser at the charge desk. The residents positioning in the trauma bay. Nothing that had registered as wrong, but she'd been watching the room for clinical indicators, not for behavioral ones. That was a different filter. She hadn't been running that filter. I don't know, she said. It came out flat because it was true and she didn't have anything to dress it up with. I wasn't watching for that. We're not asking you to have caught it, Ashford said. We're asking you to watch for it now. He let that settle. 72 hours becomes potentially extended. We need eyes on this floor, on the people moving through it, on anything that presents as anomalous. And we need those eyes to be credible enough to have access without raising the kind of attention that moves the problem. The floor nurse, she said. Nobody looks at the floor nurse, he said. She almost said something. She swallowed it. There's a secondary complication, Prescott said from behind Ashford. He had been quiet until now, staying back in the way that acknowledged the rank structure in the room. The military contracts that the procurement network was manipulating. Several of them run through hospital systems. Regional medical centers with military liaison agreements. She looked at him. Coastal Pines has a military liaison agreement, she said. It does, Prescott said. Signed when? She said. 18 months ago, Prescott said. She did the math. 18 months ago was 4 months after she had taken the floor nursing job. She had not known about a military liaison agreement when she took the position. It had not been in any material she'd reviewed, which either meant it was standard administrative background noise that nobody mentioned, or it meant she should have been looking at administrative background noise more carefully than she had been. Who signed it? She said. Prescott and Ashford exchanged a look that lasted approximately 1 second. Dr. Harlan Voss, Prescott said. Juan. She went back on the floor at 9:15 p.m. and worked with the same methodical consistency she brought to every shift, because the only way to run the kind of observation Ashford needed was to be exactly what everyone already believed she was. Any deviation from pattern would register, not necessarily consciously, but in the way that people who work together in a small institutional ecosystem developed sensitivity to the texture of normal, and anything that didn't match that texture created friction. So she checked vitals. She restocked the supply cart in the corridor, which needed it. She checked on room 22, whose patient had still not eaten much, and who, once she sat with him for 5 minutes, turned out to be anxious about a procedure scheduled for the morning and needed someone to explain it slowly, which she did, and by the end he'd eaten most of a dinner roll and was watching television. While she worked, she ran the filter she hadn't been running the night before, not looking for something specific, looking for the texture of wrong, the behavioral indicators that were meaningless in isolation but meant something in aggregate. The nurse who checked the SICU board too often, the aide who came onto the floor without a clear task, the anomalous phone call taken in a hallway corner, the person who was where they were supposed to be but slightly too still in that location, the way people are still when they're listening rather than working. She found 3 things in the first 2 hours that she filed away without acting on. First, an orderly named Grant, she knew him by sight, had worked alongside him for 9 months, made 2 trips to the supply corridor between 9 and 10 p.m. Ordinarily, 1 trip maximum. The second trip yielded nothing that she could see, because he came out with the same cart he'd gone in with, and had not added anything to it. Which could mean nothing, which could mean he'd looked for something that wasn't there. Second, the night attending, a physician named Dr. Sable, who covered evening shifts 3 days a week, and whom Sera had assessed as competent but overstretched, had a phone conversation in the alcove outside the SICU at 9:40 p.m. That lasted 11 minutes. 11 minutes for a physician on a floor with 4 admitted military casualties was long. Not impossible. Long. Third, Donna Presser, at 10:05 p.m., pulled the military liaison protocol binder from the charge desk drawer, reviewed something in it for approximately 4 minutes, and put it back without making any notes. This could mean she was doing due diligence given last night. It could mean something else. Donna Presser had been at this hospital for 22 years. She was precisely the kind of institutional fixture who would have known about a military liaison agreement at the moment it was signed. Sera made no notes. Notes could be found. She ran everything in her head and kept working. At 10:30 p.m., she passed the SICU. Through the window, she could see 2 of the operators in adjacent bays, the chest tube patient and the blast injury case, both monitored, both with the specific quality of stillness that meant sedated and stable, not asleep, naturally stable. The neurosurgery patient, head wound, was in a different SICU bay she couldn't see from this angle. A third nurse was running the SICU tonight, a woman named Petra, whom Sera had categorized in her mental file as capable and not a person who cut corners. She was about to move on when she noticed the IV pump on Bay 1. The rate had been adjusted. Not dramatically. Not in a way that would trigger an immediate alarm. The parameters were still within the pump's acceptable range. But the fluid rate was 15% higher than the rate she had noted on the chart at 7 p.m., and the chart had not been updated to reflect a rate change, which meant either someone had adjusted it and not charted it, or the chart had been updated and then amended back. She pushed through the SICU door. Petra looked up. "Hey, you need something?" "Checking on the transfer from last night," Sera said, keeping it light. "Mind if I take a look at Bay 1's chart?" "Sure." Petra moved to another patient, unconcerned. Sera pulled the chart, looked at it carefully. The fluid rate in the documentation was the original rate, matching the physician orders. The pump was running faster. The discrepancy was small. It was exactly the kind of small that would not be caught on a routine check until the fluid balance at end of shift didn't add up, and by then, she looked at the IV bag, checked the label against the order. The bag was the right medication. The label was intact. She held the bag to the light, a habit from training in conditions where supply chain integrity was not something you took for granted, and looked at the fill level. The bag had been hung 40 minutes ago, according to the timestamp sticker. At the current documented rate, it should have roughly 90% of its volume remaining. It had 62%. She disconnected the bag in one smooth movement, hung a saline flush in its place. Did both things calmly, without urgency, in the way you do things when there is someone else in the room and you need them to not understand what you just did. Petra looked up. Something wrong with the line? Just swapping out, Sera said. Line was getting cloudy. Petra looked briefly at the line. It wasn't cloudy, and Petra was a competent nurse who would know it wasn't cloudy, and held Sera's eyes for a moment. Okay, Petra said carefully. Sera took the bag, walked out of the SICU, walked to the supply corridor, closed the door, and stood in the too bright fluorescent light with the IV bag in her hands. She did not have a lab here. She could not verify what she was looking at, but the rate anomaly, the volume discrepancy, and the fact that someone had adjusted that pump without charting it, any one of those things was an error. All three together was not an error. She took out her phone. Not her regular phone, the other one. 3 contacts. She sent R a message. SICU Bay 1. IV bag. Need immediate verification. Rate tampering possible. Bag secured. The response came in under 30 seconds. Secure the bag. Don't move it. Someone's coming to you. She stood in the supply corridor and waited. Rourke arrived in 6 minutes, which meant he had been in the building or very close to it. He came through the supply corridor door with a second person she didn't know, a woman in civilian clothes who carried a small field kit with the specific casual grip of someone for whom a field kit was as ordinary as a purse. Rourke looked at the bag in Sera's hand, looked at her face, and the calculation he ran was fast. "Tell me exactly," he said. She told him. Everything, in order, with the specific precision she'd been trained to deliver field reports. Sequence, observation, inference, degree of confidence in each. She did not editorialize. She did not hedge. She said what she'd seen and noted where she was certain and where she was not. The woman with the field kit took the IV bag, opened her kit, and did something with it that took 90 seconds. She looked at the result and then looked at Rourke. "Concentration's off," she said. Her voice was level and professional and had the quality of someone delivering information they would rather not be delivering. "That's not the documented medication at the documented concentration." Rourke put his hand on his phone. "What is it?" Sera said. The woman hesitated. "Tell her," Rourke said. "It's the right drug," the woman said. "Wrong concentration. About 3 times the therapeutic level, with the rate running elevated." She paused. "At the weight and condition of that patient, if this had run to completion—" "Cardiac event," Sera said. "Probably within 2 hours," the woman said. "It would have read as a complication of the original injury. Nobody would have flagged it." The supply corridor was very quiet for a moment. Sera had disconnected that bag 14 minutes ago. The operator in Bay 1 had 3 fractured ribs and a healing chest tube and had been on that pump for the better part of 6 hours before she happened to check it. "I need the floor," Rourke said. He was already typing. "I need everyone on this floor accounted for. I need to know who has had access to that SICU bay in the last 4 hours. And I need someone on the door of every room with a casualty in it." "If you lock down the floor," Sera said, "whoever did this knows we found it." Rourke looked at her. "They know we found it the moment that patient doesn't have a cardiac event on schedule," she said. "Our window is however long it takes them to figure out the timeline didn't go the way they expected." "How long?" Rourke said. "Depends on how they're monitoring," she said. "If they're watching the patient's telemetry remotely, which is possible, the SICU monitors are networked, they'll know within an hour that something changed. If they're relying on end-of-shift checks or waiting for a code to be called, we have more time." Rourke made a decision the way Rourke made decisions. Fast, committed, no visible deliberation. "I need the telemetry system isolated. Who do I call for hospital IT at this hour?" "Donna Presser knows," Sera said. "Get me Donna Presser." "Rourke." She said his name with the specific weight of someone who needs a person to slow down one step. "Donna Presser is on my list." He looked at her. "She pulled the liaison protocol binder tonight," Sera said. "I don't know what it means. I'm not telling you she did it. I'm telling you she's on the list of things I haven't ruled out. And before you put her in a room and tell her we found an adulterated IV bag in a military casualties SICU bay, you should know that." Rourke was quiet for 3 seconds. "Who else?" he said. An orderly named Grant made 2 trips to the supply corridor without visible reason. A physician named Sable had an 11-minute personal phone call outside the SICU at 9:40. That's 3 people. That's 3 people who did things that were slightly off pattern in the last 2 hours, she said. Which might mean one of them did this. Might mean none of them did this. And the person who did it moved through this floor before my shift, and I didn't see them at all. She looked at him steadily. I've been watching for 4 hours. That's what I have. Rourke handed the IV bag to the woman with the field kit. Package that. Chain of custody starts now. He looked at Sera. Can you get me access to the network junction for the SICU telemetry system without going through Presser? Possibly, she said. There's a biomedical tech on call tonight. His name is Ferris. He works nights because he likes nights, and he's done nothing unusual all shift, and he has administrator access to the monitoring network for equipment maintenance. Get me Ferris, Rourke said. She got him Ferris. It took 8 minutes. She found the biomedical tech in the basement equipment room where he always was at this hour, doing something methodical with a centrifuge. And she told him there was a network isolation request from the hospital's military liaison contact that needed to happen quietly and quickly. Ferris, who was 45 and had been doing his job long enough to recognize when a request was unusual and when it was the kind of unusual that required compliance rather than questions, looked at her once and said, "Give me 10 minutes." She went back upstairs. The floor looked normal. That was the thing about it. The floor looked exactly like the floor always looked at 11 p.m. on a Tuesday. Petra running the SICU. The night aide doing her rounds. A resident at the nursing station writing notes. The patient in room 22 was almost certainly asleep now. Donna Presser was at the charge desk. She looked up when Sera came through. "Everything all right?" Donna said. "Fine," Sera said. Donna held her look for a beat longer than the question required. "You've been in and out of that supply corridor all night." "Restocking," Sera said. Donna went back to her screen. Room 17's light is on again. Sera did not react. She picked up a tablet, signed into the system, and scanned the patient board. Room 17's light was on. Teller was awake. Either he couldn't sleep, reasonable, with 3 fractured ribs and the adrenaline cycling down, or he'd heard something, or someone had been in his room. She walked to room 17. I was sitting up, same as before, but the quality of the stillness was different this time. His good arm was not resting on his knee. It was braced on the side rail in the way of someone who has been ready to move and has been staying still through a deliberate decision rather than a natural one. "Someone was in the hall," he said, before she could say anything. She stopped at the door. "When?" she said. "About 20 minutes ago. I heard them stop outside the door." He met her eyes. "They didn't come in. They stood there for maybe 30 seconds and moved on. Could have been nursing rounds. Rounds walk differently," he said. "Rounds have a rhythm. This was someone stopped, listening, or deciding something." He paused. "After they left, I heard the SICU door." She processed that. "You could hear the SICU door from here," she said. "It's a specific sound," he said. "The pneumatic seal. I've been listening to this floor for 2 days. I know which doors have that seal." He looked at her with the precision of someone making a point they want clearly understood. "Someone went into the SICU about 20 minutes ago, not from the nursing station side, from the corridor, and then they left." 20 minutes ago. She had disconnected the bag 14 minutes ago. Whoever had entered the SICU 20 minutes ago had potentially gone in to check on what was there, or to finish something that was already done, or to verify a status. And they had been standing outside this room first, which meant they knew who was in room 17. "You need to be moved," she said. He looked at her. "I'm not sure, a different room." "Not a different room," she said. "A different floor." "On what medical justification?" "Elevated pain indicators requiring closer monitoring," she said. It was not true. His pain was managed and his vitals were stable. "I'm documenting a precautionary transfer to the step-down unit on 2. He studied her face. "What did you find?" he said. She should not tell him. The chain of information here ran through Rourke and Ashford and Prescott, not through her, and Teller's clearance level for this specific situation was not something she'd been briefed on. She also needed him to move without an argument, and he was not a man who moved without understanding why. "Someone interfered with your teammate's IV line," she said, keeping her voice low. "We caught it. Nobody was harmed. But whoever did it knows this floor, and they were outside your door 20 minutes ago. Teller did not blink. Okay, he said. That was it, just okay. No interrogation, no performance of alarm, no refusal. He shifted his position in the bed and started untangling his monitoring leads from the rail with his good hand. I'll need a hand with these, he said. Stupid gown design. She crossed the room and helped him with the leads. He was careful about his ribs, deliberately careful, with the focused attention of someone managing pain by not doing the things that made it worse rather than by asking for relief. Up close, she could see the bruising along his left side from the initial impact. It was the color of something that had been damaged from the inside out. Who's the most dangerous person on this floor right now? He said quietly, while she sorted the leads. I don't know yet, she said, but you have candidates. 3. Trust your instincts, he said. You trusted them on my ribs. She looked at him briefly, then went back to the leads. Can you walk? She said. Yes. Slowly. Slowly is fine. She signaled through the doorway to the aide at the end of the hall, a gesture that meant she needed a wheelchair, not urgent. The aide went for one without asking. Sera disconnected Teller's remaining monitors. He was stable enough for a brief unmonitored transfer and helped him ease forward off the bed. He was heavier than he looked, not in a way that caused problems, just in the way that people with his build and training always were, dense and solid and moving with the quality of something that had been engineered for stress. He got his feet on the floor and didn't wince. She could see him not wince, which was different. We're going to walk to the end of the hall, she said quietly. I'm going to act like this is routine. You're going to act like you're a patient who needs a transfer. Nobody on this floor needs to know it's anything else. I've done cover and move in worse conditions, he said. This is a hospital, she said, so hopefully not the same skill set. He looked at her sideways. Was that a joke? Observation, she said. The wheelchair arrived. She helped him into it. He took her arm without making it a thing, just used the support, which told her the ribs were worse tonight than the 6 he'd admitted to. She wheeled him toward the elevator with the calm pace of routine patient transport. And the floor looked exactly like the floor looked, and nobody stopped them, and she pressed the call button for the elevator and waited. The elevator doors opened. Inside was the orderly named Grant. He looked at her. He looked at Teller. His expression did not change. That was the problem. In the specific calculus of behavioral tells, the expression of a person who sees something unexpected usually changes, even slightly, even for half a second. An authentic reaction is involuntary. Grant's face produced nothing. The complete absence of a response to an unexpected encounter in a man whose job had taken him twice unnecessarily to the supply corridor tonight was not nothing. It was its own kind of answer. She held the elevator door open. Going down, she said. Going up, Grant said. He stepped out, past her, did not look back. She wheeled Teller into the elevator and pressed 2. The doors closed. That was him, Teller said. I don't know that, she said. Your hand tensed on the chair, he said. Just briefly, but it did. She looked at the elevator doors. Yeah, she said, that might have been him. The elevator descended 1 floor and opened onto 2. Her phone vibrated. The secondary one. The message from Rourke said, Ferris isolated the telemetry, found a second anomaly. Medication administration log in the SICU was accessed and partially altered at 21:52. System log shows access from a badge registered to housekeeping staff. Badge was reported stolen 2 days ago. She read it twice. 2 days ago. The badge had been stolen 2 days ago, which meant this had been planned before the operators were even transported here, which meant the destination had been known far enough in advance that someone had time to position an asset, steal a credential, and set up a mechanism, which meant the leak was not just about the mission. The leak was specifically about this hospital. She looked at Teller. Change of plan, she said. What kind of change, he said. The kind where 72 hours just became tonight, she said, and pushed the wheelchair toward the step-down unit and took out the phone to call Rourke back, and was halfway through dialing when the fire alarm on the floor above them, the 3rd floor, the floor she had just left, the floor where 3 other operators were sleeping in monitored bays, detonated across every speaker in the building. Not a drill. She knew the difference between a drill and not a drill. Everyone who had ever been in a building where alarms meant something learned the difference. This was not a drill. She was already moving before the echo of the first alarm cycle finished. Not running. Running in a hospital during an alarm was how patients got hurt, how staff collided in corridors, how the controlled chaos of emergency response became actual chaos. She moved fast and with direction, which was different. She pushed Teller's wheelchair hard to the left, past the step-down unit entrance, to the alcove beside the nurse's station, on 2 where the emergency response board lived. "Stay here," she said. "Not a chance," he said. "You have 3 fractured ribs and no shoes." "Tell me what to do from the chair," he said. "I'm not sitting in a room by myself while something's happening upstairs." She looked at him for half a second, made the calculation. "Fine." She turned to the step-down nurse, a young man named Ortega, who had come out of the station with the alarm still sounding overhead, face set in the practiced readiness of someone running the protocol. "Which zone?" Ortega checked the board. "3rd floor east, SICU corridor." The SICU corridor, where 3 operators were sleeping in monitored bays. She took out her phone, called Rourke. He picked up in one ring. "3rd floor," she said. "I see it," he said. I'm on the stairs. What's your position?" "2nd floor with Teller. What are we looking at?" "Unknown. Alarm pulled from a station near SICU Bay 3. A sound of a door, concrete stairwell, the specific echo of it. Petra is the only nursing staff in the SICU. I need you up here." "I'm coming," she said. She looked at Ortega. "Lock down the step-down unit. No one enters or exits without your visual confirmation of who they are. You understand?" Ortega, to his credit, did not ask why. He nodded and reached for the unit phone. She looked at Teller. "I mean it about the ribs. You move and you're on your own." "I've been on my own before," he said. "Go." She went. The 3rd floor stairwell door opened onto a hallway that was operating in the specific register of a fire alarm with no visible fire. Controlled urgency, no smoke, staff moving with purpose rather than panic, patients in rooms who had been told to stay put and were mostly doing so. The alarm was still sounding overhead in 2-second intervals, the kind of rhythm that was designed to be taken seriously without triggering mass evacuation. Rourke met her in the corridor outside the SICU. He had his jacket off, which meant he'd been moving fast in a stairwell. Behind him, one of the suited aides she'd last seen on the 2nd floor was talking into an earpiece with the compressed focus of someone receiving and relaying simultaneously. "Alarm was manual pull," Rourke said without preamble. "Station 17, East Corridor. Nobody pulled it. It's on camera. Nobody near it at the time it triggered." "Remote activation?" "Possible. Biomedical is looking at it." He glanced toward the SICU. "Petra reported someone attempted to access Bay 3 approximately 8 minutes ago. She turned them away. She didn't recognize the badge, said it looked like housekeeping, but then the alarm went and she lost track. Housekeeping badge, the one reported stolen 2 days ago." "Where's Petra now?" she said. "Inside, managing the patients." "The patients? Stable, last check, 57 seconds ago." She pushed through the SICU door. Inside, the monitoring equipment ran its steady ambient rhythm over the controlled alarm cycling from outside. Bay 1, the chest tube patient, the one whose IV she'd disconnected 2 hours ago, was awake. She could see him through the glass partition, eyes open, tracking the room. Bay 2, the blast injury patient, was sedated, vitals steady on the monitor. Bay 3 was at the far end. Petra was at the Bay 3 station when Sera came in, and the look on her face was the look of someone who had been holding a professional composure together through an act of sustained will. "He's stable," Petra said immediately. "I've checked him twice since the alarm. Nothing's changed." The person who tried to come in, woman, mid-40s maybe, gray scrubs, housekeeping badge, said she needed to check something in the equipment room at the back. Petra paused. "I told her equipment access during evening hours went through the charge desk. She left." "Which direction?" "East corridor, toward the service elevator." Sera looked at Rourke, who was already directing the aide toward the service elevator. She went to Bay 3, looked at the patient, the neurosurgery case, the head wound. How was sedated and ventilated, intracranial pressure monitor in place, the specific suspension of bodily function that post-neurosurgical sedation required. She checked the IV lines, 2 of them, running from separate pumps, both at the documented rates, both bags at appropriate fill levels for the time elapsed. She checked the ventilator settings. The tidal volume was off by 6%. Low, not high. The documentation said 500 milliliters. The machine was set to 470. 6% was within the range of clinical adjustment. A physician might reduce volume for various reasons. She pulled the chart. No order for a change. No note from the attending. No documented respiratory therapy visit. She reset it to 500. The difference was not immediately dangerous, not at the level of the IV tampering. But it was wrong, and it was exactly the kind of wrong that accumulated over hours into a respiratory complication that read as a post-surgical deterioration rather than an intervention. She documented it, photographed the chart and the monitor display with her phone, and turned back to Petra. "Has anyone other than you and the attending been in here tonight?" The aide from 4 came through around 9 to help with repositioning Bay 2. Petra stopped. And Dr. Sable was in around 9:40 for chart review. 9:40. Exactly when she'd clocked Sable's 11-minute phone call outside the SICU entrance. Was he alone? Yes. He reviewed Bay 3's chart specifically. I remember because I thought it was a bit... She stopped. "What?" Sera said. "I thought it was a bit late for a chart review on that patient," Petra said carefully. "He's post-neuro, not Sable's service. But he said he was covering for Dr. Okafor." Okafor was the blast injury attending, not the neurosurgical attending. There was no clinical reason for Sable to be reviewing the neurosurgery patient's chart under Okafor's coverage. Sera took out her phone, called Rourke again. "I need Sable found, right now." "Working on it," Rourke said. "We've got a bigger problem." Something in his voice. "What?" she said. "The aide. The one I sent to the service elevator." A pause. "She found someone. It's not the woman Petra described." "Who is it?" "I need you in the East Corridor," he said. The East Corridor of the 3rd floor terminated at a service elevator and a supply room that was used for overflow equipment storage. Between the SICU entrance and the service elevator, there was a stretch of hallway with one overhead light currently flickering, a maintenance issue that had been on the work order list for 3 weeks and that nobody had gotten around to, and 2 equipment alcoves. Grant the orderly was sitting on the floor in the second alcove, his back against the wall and his legs extended in front of him, in the way of someone who had been placed there rather than chosen to sit there. His wrists were zip-tied, not aggressively. The restraints were snug but not cutting, but definitively. Rourke's aide was standing over him. Sera looked at Grant. Grant looked at her with an expression she read in 1 second. Not fear, not anger, calculation. The expression of someone running a live assessment of their options. "He was coming out of the supply room," the aide said. "He had this." She held up a small device, and handheld, gray, the size of a thick phone, that Sera recognized as a medical equipment interface tool, the kind used for remote parameter adjustment on networked monitoring systems. Grant said nothing. Rourke crouched in front of him. "We have the IV bag. We have the telemetry access log. We have the badge record from the stolen credential." He said it matter-of-factly, the way you present a completed equation. "You understand what I'm telling you?" "I want a lawyer," Grant said. "You'll get one," Rourke said. "First you're going to tell me where the woman with the housekeeping badge went." "I don't know what you're—" "Grant." Rourke's voice did not change in volume or temperature. It just became more precise, the way a blade becomes more precise when it's being used correctly. "The fire alarm you triggered remotely was meant to create a window. The window was supposed to last long enough for someone to complete a task in Bay 3. That task was not completed because Sera caught the IV anomaly 2 hours ahead of schedule, and the patient was already being monitored when you triggered the alarm." He paused. "Which means whoever you're working with knows the operation is compromised. They are making decisions right now about what to do next. And one of the things they might decide to do is remove the person who can connect them to what happened tonight." Grant's jaw tightened. "That person," Rourke said, "might be you." Silence. The flickering light overhead made the alcove pulse slightly. Grant said, "She went down the service stairs. She was going to the parking structure." Rourke stood up, looked at his aide. "Call it in." Looked at Sera. "Stay with the patients." "Rourke, stay with the patients," he said, and moved. She looked at Grant. Grant looked at the floor. She went back into the SICU. What followed was the kind of waiting that she had never gotten better at, regardless of how many times she'd done it. The waiting where the action had moved somewhere else, and all she could do was maintain her position and manage what was in front of her. She checked every line, every monitor, every parameter across all 3 SICU bays with the systematic thoroughness of someone who could not afford to miss a third thing the way she'd nearly missed the ventilator. Bay 1 patient. She had started thinking of him by his presentation rather than his name, the way she'd learned to in field conditions because names were weight you couldn't always carry, was awake and watching her work. He couldn't talk easily. The chest tube restricted certain movements and the pain management kept him in a managed state. But his eyes tracked her with the same quality of alert attention she'd seen in Teller. She checked his tube placement, checked the drainage, noted the output volume and color, appropriate for the stage of healing, nothing indicating reaccumulation. She adjusted his position by 2 degrees, which she could see by the slight release in his expression made a difference. "You're doing well," she told him, because it was true, and because people in hospital beds needed to hear true things. He blinked twice, which she took as acknowledgement. She was on her second pass through Bay 2's monitoring when Rourke came back. She could tell from the way he came through the SICU door that they hadn't gotten her. "Service stairs to the parking structure," he said. "She was in a vehicle by the time our people reached level 2. We have the plate. It's reported stolen." "Of course it is," she said. "We have footage. We'll get an ID." "How long will that take?" "Faster than it used to," he said. "Hours, not days." "What about Sable?" Rourke's expression shifted. Not dramatically, but she'd learned to read him in less than 48 hours, which was not unusual for her, and people operating in compressed, high-stakes proximity. Something had resolved itself in Rourke's assessment. "Sable is in his office on 4, he said. "He came back 20 minutes ago. He's been cooperative." "Cooperative how?" He confirmed the chart review. Confirmed he was asked to look at specific parameters in Bay 3 by someone who contacted him through his personal email and identified themselves as a colleague. Rourke paused. "He didn't alter anything. He says he looked at the chart, saw nothing unusual, and left. He didn't know what he was supposed to be looking for." "Then someone told him to go in there to provide cover," she said. "That's what we think. Someone who knew his schedule, knew he covered certain services, used him as a reason for a second set of footprints in the SICU." Rourke looked at her steadily. "Which means the person running this has institutional knowledge of this hospital, staff schedules, service coverage patterns, equipment access protocols." She had been thinking about this for the past 40 minutes. "The liaison agreement," she said. "Voss signed it 18 months ago. Who drafted it on the hospital side?" "Administration," Rourke said. "Who specifically?" A beat. "We're looking at that." "Look faster," she said, "because Grant is an orderly who had a remote access tool for networked medical equipment. That tool doesn't come from nowhere. Someone gave it to him, which means someone who understands this hospital's technical infrastructure sourced it and configured it." She pulled off her gloves. "That's not a person who found this hospital in a file. That's a person who knows this hospital the way you know a place you've worked in." Rourke was very still. "Or a place," she said, "you've specifically prepared." He took out his phone and made a call that lasted 40 seconds, during which she returned to her work, and he stood near the SICU entrance speaking in the compressed shorthand of someone who needed something immediately and had the authority to get it. When he hung up, "I need you to go talk to Donna Presser." She stopped. "You pulled her off the list." "I did," he said, "and now I'm putting her back." He looked at her with the expression of someone who doesn't like what they're about to say. The liaison agreement wasn't just signed by Voss. The administrative co-signatory was Donna Presser. She found Donna at the charge desk, exactly where Donna always was, which was a thing about Donna Presser that had always been true and now carried a different weight. It was 12:30 a.m. The alarm had been silenced. The floor had returned to its nighttime rhythm. From the outside, in the particular institutional quiet of a hospital past midnight, nothing would look different. Sera sat down in the chair beside the charge desk, not across from it, beside it. She did that deliberately because sitting across from someone put a barrier between you and sitting beside them didn't. Donna looked at her. Long night, Donna said. Yes, Sera said. Donna. She kept her voice quiet, not soft, quiet. There was a difference. I need to ask you something, and I need you to think about it before you answer. Donna's expression did not perform surprise or offense, which itself was information. She just looked at Sera with the level steadiness of a woman who had been in this building for 22 years and had survived a lot of things that had happened in it. The military liaison agreement, Sera said. You co-signed it 18 months ago. I did, Donna said. Did you understand what it covered? Military casualty reception protocol, facility readiness standards, communication chains for medevac coordination. Donna held her eyes. Standard liaison framework for a hospital near a military installation. We're 20 miles from Braxton Air Station. It made operational sense. Who brought it to you? A pause. Small but present. Harlan, Donna said. Dr. Voss. He had the administrative package prepared, said it came through the hospital board in coordination with a federal contractor. What contractor? Another pause. Longer. I don't remember the name, Donna said. It was in the documentation. The documentation that Voss prepared. Donna looked at her for a long moment. Sera, she said, and it was the first time Donna Presser had used her first name in 14 months. What's happening in this hospital tonight? She looked at Donna. 22 years. The woman who had handed her the mop bucket in the first week. The woman who had said she was sweet but not ER, in the break room, in a voice that wasn't unkind but wasn't kind either. The woman who knew the institution better than the institution knew itself. Someone tried to kill the men upstairs tonight, Sera said. We stopped it, but the operation that enabled it was built using the access and infrastructure of this hospital, and that construction involved the liaison agreement that you and Voss signed. Donna's face went through something she didn't try to hide. Not guilt, shock, moving into the particular horror of a person who has realized they were used. I didn't know, Donna said. I believe you, Sera said. And she did. Donna Presser was not a woman who could sit at the charge desk all night while someone tried to kill patients on her floor and maintain that level of ordinary. What she was a woman who had signed something she was told was routine and had not looked closely enough, which was a different category of failure. But I need the documentation, everything you have on the liaison agreement, paper, digital, anything. It's in the admin system, Donna said. She was already reaching for the terminal. And there's a physical binder. I pulled it tonight. I wanted to understand the protocol for... She stopped. For what? Sera said. I pulled it because I've been watching you move around this floor for 2 days like you were looking for something, Donna said. And I wanted to know what I'd missed. She looked at Sera directly. 22 years and I missed something. You missed Voss, Sera said. Not the hospital. Donna printed the documentation without being asked. At 2:15 a.m., Rourke's team had the contractor name from the liaison agreement documentation, Meridian Medical Logistics Group, LLC. 18 months of operational history. Federal contracts across 4 states. Subcontracts with multiple military-adjacent hospital facilities. By 3 a.m., the federal layer had pulled Meridian's financials and found the thread that connected it to the procurement network the SEAL team had been sent to investigate. The same network supplying falsified equipment specifications. The same network someone had died to protect by burning the mission. By 3:30 a.m., the thread led back, through 3 layers of corporate structure, to a board member who had been authorized to negotiate the Coastal Pines liaison agreement personally. That board member's name was on the documentation in Donna Presser's binder. It was not Harlan Voss. Voss had signed the agreement, had brought it to the hospital, had been the visible hand on it. But the person who had structured the agreement, who had written the access provisions that gave Meridian's contracted staff credential access to the facility, who had designed the technical infrastructure that allowed a remote access tool to interface with networked medical equipment, that person had arranged all of it through Voss, using Voss's ambition and his appetite for contracts and his tendency to read carefully enough to sign, but not carefully enough to understand. Voss was not the architect. Voss was the door that someone else had opened. Sera was sitting in the family consultation room on 2, the same room Ashford had brought her to, which felt like a week ago and had been approximately 8 hours. When Rourke came in with the file and set it on the table between them, She looked at the name on the board membership documents. Do you know him? Rourke said. She looked at the name for another second. No, she said. I don't know him personally. She paused. But I know the company. Meridian Medical Logistics. She looked at Rourke. I know it because I've seen their equipment in the field. Not here, before. In a theater where the supply chain was supposed to be verified. She kept her voice level and steady. There was an incident, a resupply kit that didn't contain what the manifest said it contained. A soldier who needed a specific airway intervention in a forward position where the kit was the only resource available. Rourke was looking at her carefully. He survived, she said, because I had a secondary kit, and I happened to have the right equipment, and I happened to be there. But the kit that failed was Meridian sourced. She looked at the file. I flagged it. I filed a report. It went up the chain and I was told it was an isolated manufacturing error and the matter was being reviewed. It wasn't reviewed, Rourke said. No, she said. I can see that. The room was quiet. The person who tried to kill those men tonight, she said. The woman who went through the parking structure, Grant, who was sitting in the alcove. The ventilator settings that were off 6%. The IV that would have run 3 times concentration to completion. She stopped. This wasn't improvised after the mission failed. This was prepared in advance because they knew if the mission somehow succeeded despite the burn, 4 men who had the documentation they went in to get would end up here, in this facility, with access built into the infrastructure that they could use to finish what the mission failure didn't. Rourke was still. They planned to use this hospital as a second kill attempt, she said. Yes, he said. And the only thing that disrupted it was me, she said. Yes, he said. She looked at the file on the table, the name of the board member. The documentation that had sat in Donna Presser's binder for 18 months, innocent-looking, routine-appearing, waiting to be useful for something that had nothing to do with casualty reception protocol. I need Voss, she said. Rourke looked at her. Not to arrest him, she said. Not yet. I need to talk to him before this moves into formal proceedings, because Voss knows things he doesn't know he knows. He was used, which means he interacted with people who were using him without his understanding that's what was happening. And those interactions contain information about how this network operates and who is in it that Voss is going to be very willing to provide once he understands what he was actually part of. Our investigators can... I've been working alongside this man for 14 months, she said. I know how he thinks and what he responds to and what he's afraid of. Your investigators will get there. I can get there faster. Rourke looked at her for a long moment. He's in his office, he said. He's been there since midnight. He knows something is happening. He doesn't know what. Does he know I'm involved? He knows more than he did this morning, Rourke said carefully. Then he's been sitting in his office for 2.5 hours, she said, building a version of tonight's events that protects him. That's what Voss does. He organizes narratives. She stood up. Let me go before the narrative hardens. Rourke did not immediately answer. She watched him calculate. I'll be outside the office, he said. She walked out of the consultation room and took the elevator to the 3rd floor and walked past the SICU, where through the window she could see Petra still running her patients with the careful competence she always brought, and down the corridor to the administrative wing, where the lights were lower and the carpet started and the hospital's daytime personality lived in offices currently dark. Except one. Voss's light was on under his door. She knocked twice. Come in, he said. He was at his desk with a glass of water he hadn't touched and a file folder open that he'd clearly been looking at before he heard her knock and closed it. He looked like a man who had been in a controlled state for several hours and was beginning to feel the maintenance cost of it. When he saw it was her, something in his expression did something complicated. Calloway, he said. She sat down across from him. Not beside him, across. She needed him to see her clearly from where she was. Dr. Voss, she said. I need to tell you something, and I need you to listen before you say anything. He looked at her. The practiced authority was still there, but its quality had changed. It had the feel of a wall that was structurally sound, but had been hit a few times recently and was being monitored. The men upstairs tonight were the targets of a coordinated operation designed to use this hospital as an instrument, she said. An IV line was tampered with. A ventilator was adjusted. A fire alarm was triggered remotely. A man named Grant, your evening orderly, has been taken into custody. A woman who had a stolen housekeeping badge got away through the parking structure. She paused. All of this was enabled by the infrastructure built into the Meridian Medical Logistics Liaison Agreement that you signed 18 months ago. Voss's face had gone the color of old cement. I didn't, he started. I know, she said. I know you didn't know what you were signing. I know it was presented to you as administrative standard and that you had every reason to believe it was what it appeared to be. I know Meridian was represented to you as a federal contractor with legitimate credentials, and that nothing in the standard review process would have flagged what was underneath it. He was silent. But I need you to tell me, she said, everything you remember about who brought Meridian to your attention, every conversation you had about the agreement, every person at that organization who you interacted with, and everything they said. She held his gaze. Because you were used by people who knew that your hospital's military relationship would make this facility a useful tool for killing soldiers, and the only way to find every part of this network is for you to tell me everything you know. Voss looked at her for a long time, not with the contempt that had been his default for 14 months, not with the reassembled authority he'd been performing all evening. He looked at her with the expression of a man who was looking at something clearly for the first time after a period of deliberate not looking and finding the clear view significantly worse than the alternative. I brought it to the board, he said. His voice came out without its usual engineering. A man named Darren Price introduced me to the Meridian program at a medical administration conference in Atlanta. He was well connected. He seemed... Voss stopped. He understood how hospital systems worked. He understood the contracting landscape. He told me the liaison program would put Coastal Pines on a federal prioritized facility list. Price, she said. Darren Price, Voss said. He had business cards, a LinkedIn profile, references I checked. He looked at the closed file folder on his desk. He called me 3 days ago. She went still. He called you 3 days ago, she said. Before the mission, before the operators came in. He said there might be a military transport to our facility in the coming days, Voss said. He said Meridian wanted to ensure their liaison protocol was being followed and asked me to review the access provisions. Voss looked at her. He asked me specifically who was running our night shift on the SICU. The room shifted. 3 days ago. 2 days before the badge was stolen. Before any of this had officially begun. Voss had been told to look at SICU staffing 3 days ago, which meant Darren Price, whoever he actually was, whatever his actual name was, had known the transport was coming before Voss had, before the operators had been deployed into the field, potentially before the mission had even been executed. Did you tell him? She said. Voss's jaw tightened. I told him the standard protocol, he said. I told him our SICU was competently staffed and the liaison provisions were being maintained. He paused. He asked if there had been any staffing changes, any new personnel on the clinical floor. Sera looked at him. I told him our floor nursing team was stable, Voss said. I told him there had been no significant changes. No significant changes. Which meant Price had been trying to determine, 3 days before the operators arrived, whether the person he might not have known was embedded in this hospital was still in place, or whether she had moved on. And Voss, who had spent 14 months refusing to believe she was anything, had told him, accurately from his perspective, that nothing had changed, which meant Price had not known she was here. She processed that. Did he ask any other questions? She said. Voss opened the folder on his desk. Inside was a call log. He had printed it, she realized. He had printed the call log from his office phone and been sitting here looking at it for 2.5 hours. He asked one more thing, Voss said. He turned the page toward her. She looked at the notes he'd written beside the log entry. In Voss's precise, controlled handwriting, Price asked specifically, civilian night shift authorization for unscheduled medical procedures. Who has override authority if senior staff is unavailable. She read it twice. Who has override authority? Not what the protocol was. Who specifically could act without authorization if the situation required it. He had been trying to find out if there was a wild card on this floor. Someone who might intervene without the chain of command that he'd built into the access provisions. He'd been trying to identify her without knowing her name. And Voss, sitting here with this call log, having spent 2.5 hours building a narrative, had just handed her the thread that connected Darren Price's pre-mission preparation to the specific attempt to understand who might stop them. "Dr. Voss," she said. She kept her voice level. It cost something to keep it level. "I need you to write down everything you just told me, in as much detail as you can recall. Every word of that call." Voss looked at her. "I want to help," he said. It came out raw, which surprised her. Not performed. The actual sound of a man who understood, finally and fully, what room he was actually standing in. "I know," she said. He started. "Write it down first," she said. "There'll be time for the rest." She stood up and stepped into the hallway where Rourke was waiting, and she handed him the printed call log, and she said, "Darren Price. He called Voss 3 days ago. He was profiling the floor for a wild card, trying to find out if anyone here could act outside the chain he'd designed." She held the log out. "He didn't know I was here, but he was looking for someone exactly like me." Rourke took the log. "That means," he said slowly, "we have him trying to profile a variable he didn't know existed." "Which means when his operation failed tonight," she said, "he's going to try to understand why. He's going to go back to that call. He's going to realize that Voss told him the floor nursing team was stable and unchanged, and he's going to wonder what stable and unchanged produced a result that should have been impossible." She looked at Rourke. "He's going to come looking." Rourke looked at her. "For you," he said. "For whatever stopped him," she said. "He doesn't know my name. He doesn't know what I am. But he knows that something in this building interfered with a precision operation that should have been airtight, and he is going to want to understand what." She held Rourke's gaze. "Which means we have one window, before he goes dark or runs or restructures the operation around the failure." "What kind of window?" Rourke said. She took a breath. "The kind where we let him find what he's looking for," she said. Rourke looked at her for a long moment in the way he looked at things he was about to agree to and didn't entirely want to. "Walk me through it," he said. "Price called Voss 3 days ago to profile this floor. He knows the call happened. When his operation fails tonight without explanation, he goes back to the call and asks himself what he missed." She kept her voice low and even. "He didn't know I was here, but Voss told him the floor nursing team was stable and unchanged, so whatever stopped him came from the existing staff, someone he didn't account for. He's going to want to know who." "So we put the information where he can find it," Rourke said. "We let the answer surface naturally. Voss writes his statement, all of it, including the call. That statement enters the record. Price has enough institutional reach to access preliminary documentation from a facility investigation. He's done it before, or he wouldn't have been able to design this operation with the level of inside knowledge he had." She paused. "He finds the statement. He finds a floor nurse named Calloway who apparently performed an unauthorized needle decompression and flagged an IV anomaly. He starts pulling that thread. And when he pulls it, he finds exactly what we want him to find," she said. "A floor nurse with an unusual background that doesn't quite add up. Enough of a trail to make him think he's found his variable. Enough to make him move." "He'll come in person," Rourke said. "Not a question. He'll send someone first, and then, when that someone reports back, he'll want to see it himself." She looked at him steadily. Men who build operations like this don't trust secondhand assessment when their own network is compromised. They come in to verify. That's when you take him. Rourke was quiet. "You're the bait," he said. "I'm the explanation he can't resist," she said. "There's a difference." He did not look convinced of the difference, but he called Ashford. But the next 18 hours were the strangest of the 14 months she had spent at Coastal Pines, and that was competing against a significant field of candidates. She went back to work. Not as a performance, as the actual thing. The floor still needed nursing. The patients upstairs still needed monitoring. The morning shift arrived at 7 and needed a coherent handoff, which she provided, and the details she included about the SICU cases were clinical and accurate and entirely devoid of what had happened in the East Corridor at midnight, because the morning shift nurses did not need that information to do their jobs, and giving it to them would only complicate the controlled environment Rourke's team was maintaining. She slept for 4 hours in her apartment, set an alarm, got up, ate, and went back. Voss's statement had been completed by 6 a.m. and entered into the federal investigation record by 9 a.m. The documentation moved through channels that looked like a routine facility audit to anyone who wasn't reading the specific metadata. Rourke's team had confirmed that Meridian maintained a contracted information services firm that monitored federal audit databases for mentions of partner facilities. The flag would register. The timeline on how fast Price would move depended on how nervous he already was, and Rourke's assessment, which she agreed with, was that he was very nervous. Grant had been transferred to federal custody at 5 a.m. without announcement. The woman from the parking structure had been identified from the camera footage by 7:30 a.m. as a contract operative with 3 prior aliases and no current address. A warrant was issued. She was picked up at a motel outside Charlotte at 11 a.m. Dr. Sable had given a full voluntary statement and been placed on administrative leave pending the investigation's conclusion. He had not known what he was part of. His mistake was not malice, but a professional carelessness, accepting an unusual task without sufficient verification because it had come from a familiar-seeming channel and he was overextended and tired. He was going to have to live with what that almost caused, and from the look on his face when he finished his statement, he understood that. Donna Presser was not placed on leave. She had co-signed a document she hadn't scrutinized adequately, which was a failure of institutional vigilance. But the investigation found no evidence she had knowingly participated in anything. She came in for her regular shift at noon and ran the floor with the same authority she always brought to it, except that she stopped at the charge desk once and looked at the mop in the supply closet doorway for a long moment and then went to work. Sera noticed. She said nothing. The operators in the SICU were progressing. The chest tube patient, she had learned his name was Waylon Burke, 34, from Eastern Tennessee, married with 2 kids whose photos were in a waterproof case in his tactical gear, was breathing without the pained asymmetry of the first night. The blast injury patient was being weaned from sedation. The neurosurgery patient had been evaluated by the neurosurgical attending and was showing indicators of a meaningful recovery trajectory, which the attending had described with the careful optimism of someone who had been doing neurosurgery long enough to know that meaningful and certain were different words. Teller had been moved back to the 3rd floor. I was eating real food and had fixed the hospital gown situation by demanding a second one and wearing it correctly layered over the first, which the aide had found unreasonably funny and which Teller had received with the expression of a man who did not understand why this was amusing, but was willing to let it be. She checked his ribs at 2 p.m. The bruising had developed fully overnight, which made it look worse than the day before, even though he was actually improving, because deep tissue injury always announced itself loudest on day 3. You look like you slept, he said. 4 hours, she said. Better than 0. He watched her work through the assessment. Is it over? Not yet, she said, but close. She noted his respiratory effort, still controlled, still slightly effortful, still the work of a man managing pain through technique. Close, she said. How close? She looked up at him. I need you to not do anything for the next 24 hours. Whatever you're thinking about doing, don't. He held her gaze. I'm in a hospital bed with 3 cracked ribs. You've done more with less, she said. I've seen how you think. A beat. Something moved through his expression that was not quite a smile and not quite the ghost of one from before. Something more direct than that. I'll stay in the bed, he said. Thank you, she said. Calloway, he said, as she moved toward the door. She stopped. When this is done, he said carefully, are you going to be okay? She stood at the door for a moment. It was a simple question. It was also the first time anyone had asked it in approximately 72 hours, which meant it arrived with slightly more force than it would have under normal circumstances. Ask me when it's done, she said, and left before it could become anything more than that. Darren Price came to Coastal Pines at 4:17 p.m. the following day. He did not come as himself. He came with a different name on a visitor badge, the kind of visitor badge that the front desk issues to anyone who presents a plausible reason for being there, which in a mid-sized hospital near a military installation was not difficult to arrange. He came as a federal compliance auditor attached to a liaison review, which was the kind of credential that made hospital administrators nervous and cooperative simultaneously. He was 51 years old, medium height, with the careful unremarkability of someone who had spent a long time making sure he did not look like what he was. He wore a suit that was correct without being memorable. He moved through the lobby with the practiced ease of someone who had walked into institutional buildings hundreds of times and understood how to calibrate to the specific tempo of each one. Rourke's team had 3 people inside before he reached the elevator. Sera was at the nursing station on 3 when Rourke's text arrived. He's in the building. Main elevator, heading up. Stay on the floor. She stayed on the floor. She was entering chart notes on a patient in room 20 when she heard the elevator doors open down the corridor, and she kept entering notes because that was what a floor nurse did at 4:17 p.m. on a Thursday afternoon. She heard him before she saw him. Footsteps with a particular cadence, unhurried but purposeful, the walk of a man assessing an environment while appearing to simply move through it. She had heard that walk before. She had been trained to produce that walk. He came around the nursing station corner and stopped. She did not look up immediately. She finished the note she was entering, 3 more seconds, deliberate, and then looked up. He was looking at her with the specific focus of a man who had been searching for a particular variable and believed he had found it. "Can I help you?" she said. "I'm looking for the charge nurse," he said. "I'm conducting a federal liaison review. I have authorization from the administrative office." "Donna Presser," she said. "She's down the hall. I can let her know you're here." She reached for the desk phone. In doing so, she turned her badge toward him, the badge that said Calloway in block letters above nursing staff. And she watched, from her peripheral vision, the specific micro-shift in his expression that was not visible unless you were looking for it. He had the name. He was confirming the face. "Actually," he said, "you might be able to help me. I have some questions about the nursing staffing structure for the SICU floor." He held the clipboard in a way that was performing documentation. "Have you been on this floor long?" 14 months, she said. "And you work the SICU corridor?" "I'm the floor nurse for the acute wing," she said. "The SICU has its own staff." "But you have access to the SICU." She looked at him with the mild, slightly guarded expression of a nurse who finds an auditor's question slightly unusual but is trying to be cooperative. "Clinical staff have access to all patient areas in their zone, yes. Is there a specific concern?" He looked at her steadily. She could see him running the calculation. The thing he'd come to verify, the variable Voss's statement had surfaced. A floor nurse with an unusual response history, unauthorized procedures, a background that didn't match her performance. I was deciding whether she was what he thought she was. She let him look. She gave him nothing except the mild cooperative confusion of a woman who had nothing to hide, which was one of the harder things she had ever held in her face for a sustained period while someone with his particular skill set examined it. "One more question," he said. "Were you on shift the night the military casualties came in?" "I was," she said. "It was a difficult night." He held the look for 2 more seconds. Then he said, "Thank you for your time," and turned back toward the elevator. He made it 12 feet. Rourke came around the corner with 2 federal agents and 2 uniformed military police and said, "Darren Price, federal agents, do not move." The corridor did what corridors do when that sentence is spoken in them. It froze. A resident who had been walking toward the nursing station stopped in his tracks. A nurse coming out of a patient room pulled back. The ambient sound of the floor dropped to nothing for 1 full second. Price did not run. She had not expected him to. Men like Price did not survive as long as he had by running in corridors. He stopped. He turned slowly. He looked at Rourke with the expression of someone doing very fast legal computation. "I have authorization," he started. "You have a fraudulent federal credential and an outstanding warrant in connection with the deaths of 2 overseas contractors, the attempted murder of 4 military personnel, and a procurement fraud network operating across 17 federal contracts." Rourke held his gaze without emphasis or theater. "The authorization is not the issue right now." Price looked at Rourke. Then his eyes moved past Rourke to Sera, still at the nursing station, still holding the chart tablet, not performing anything now, just standing there, watching him look at her, watching him understand what the variable had actually been. Not a wild card, not an anomaly the system had failed to account for. A trap, built from 14 months of being underestimated so completely that nobody had thought to warn him. She watched him understand it. He did not say anything. There was nothing to say. The agents moved to either side of him, and the corridor resumed its function around the event. The way hospital corridors do. Because a hospital is a place where extraordinary things happen in ordinary spaces, and the building absorbs them and moves on. He was walked to the elevator. The doors closed. The resident who had stopped in the hallway stood there for a moment and then continued toward the nursing station. The nurse who had pulled back from her patient's room went back in. The ambient sound of the floor returned. Sera set down the chart tablet. Her hands were steady. They were always steady. She had stopped finding that remarkable. What? The formal proceedings that followed were not fast or clean, because formal proceedings never are. They were thorough, which is the better quality. Price was charged federally: procurement fraud, conspiracy, attempted murder of military personnel, obstruction. The charges were specific and documented. The evidence chain unbroken from the IV bag Sera had pulled in the SICU through the call log and Voss's handwriting through the financial architecture of Meridian Medical Logistics. His legal team was expensive and his arraignment was contentious, and none of that changed the weight of what had been assembled against him. The woman from the parking structure, her actual name was Brenda Lyle, which was not the name she'd been operating under, was charged separately. Grant the orderly, whose real employment history revealed 3 prior positions at medical facilities in the Meridian network, negotiated a cooperation agreement that significantly accelerated the dismantling of Price's operational structure. Meridian Medical Logistics Group was dissolved by federal order within 30 days, its contract suspended, its financials frozen. The investigation it triggered spanned 4 states and 18 months of retrospective audit, and the falsified equipment specifications it uncovered led to a recall of 7 categories of military-grade medical supply that had been in circulation for over 2 years. That was the part that stayed with her, not the arrest in the corridor, that had been a specific moment in a specific place, and it was over when the elevator doors closed. The recall was something else. The recall was the correction of a systemic wrong that had been running long enough to have hurt people whose names she didn't know, in places she hadn't been. She thought about the resupply kit that had failed in the field, years ago. The soldier who had survived because she happened to be there with a secondary kit. All the time she hadn't happened to be there. She thought about that more than she thought about Price. Dr. Harlan Voss was not charged. His statement had been voluntary, immediate, and complete, and the investigation found no evidence of knowing participation in Price's operation, only the specific failure of a man who had been cultivated carefully and used precisely because his ambition made him useful and his self-regard made him easy to handle. The hospital board placed him on administrative review, which was a consequence he could not manage his way around the way he managed most things, and which, based on the conversation she became aware of second and third hand, was having an effect on him that was harder to watch than anger would have been. She did not feel sorry for Voss, but she did not feel the particular satisfaction she might have expected either, because watching someone realize the depth of their own manipulability was not the same as justice. It was just its own kind of damage. Donna Presser was cleared fully and formally. She received the clearance letter on a Friday morning and came in for her afternoon shift and ran the floor with the same authority she'd brought to every shift for 22 years. And the only visible change was that she had, at some point between the letter and the afternoon, rearranged the supply closet so that the mop was stored in a utility room down the corridor instead of the closet entrance. Sera noticed that too. She did not say anything about that either. Admiral Ashford came back to Coastal Pines 11 days after Price's arrest. Not with a team this time, just Rourke and one aide who stayed in the hallway. Ashford sat in the family consultation room, which was becoming the room she associated with having important conversations in uncomfortable chairs, and he set a folder on the table. "I'm going to offer you something," he said. "I'd like you to hear all of it before you respond." "Okay," she said. "The recall review and the equipment audit that came out of this investigation have identified a gap in military medical oversight infrastructure," he said. "Specifically, the lack of an independent field verification unit, people with operational medical experience who can move through institutional environments and assess supply chain integrity from the inside." He paused. "People who can work in plain sight." She looked at the folder. "You'd have a small team," he said. "Authority to access any military-adjacent medical facility. Civilian cover that can be adapted per assignment. Direct reporting line to a chain that doesn't run through the standard contracting channels that Price exploited." "You're describing what I've been doing for 14 months, she said. "Except I didn't know I was doing it." "You were doing it here because your cover placed you here," he said. "This would mean doing it intentionally, with resources and authority and people who know what you actually are. She looked at the folder, did not open it. "The men upstairs," she said. "Burke, the others." "All progressing," Ashford said. "Burke is being discharged next week. The neurosurgery patient is in rehab." He paused. "They all know what happened. They asked me to tell you." She nodded. "And if I say no?" she said. "Then you say no," Ashford said. "You go back to whatever you were building here, or somewhere else. We don't compel people who've already given what you've given." She looked at him. "That's the cleanest thing anyone in your position has said to me in 3 years," she said. "I mean it," he said. She looked at the table for a moment. Outside the consultation room, through the closed door, she could hear the floor, the specific ambient texture of coastal pines in the afternoon, the sounds she had cataloged for 14 months, until she knew them the way you know the sounds of a place that has become, despite not being home, familiar. She thought about the field that had failed, the 7 categories of recalled equipment, the people who had been hurt by a system that was running broken while everyone who could have found it was looking somewhere else. She thought about what it meant to be the only person in a room who understood what was actually happening and what you did with that, and whether disappearing into quietness was the same as being safe or just the same as being alone. "I want the team to be mine," she said. "I pick them. I vet them. Chain of command on operational decisions runs through me, not through a committee." "Negotiable," Ashford said. "Non-negotiable," she said. A beat. "Agreed," he said. She opened the folder. She gave notice to Coastal Pines on a Wednesday. 2-week standard, which she worked fully because the floor still needed nursing and she was not a person who left things half done. The last week was strange in the way that endings inside continuations are strange. The building was the same, the work was the same, and she was the same person she had been at the start of it, except that she had been seen, which changed the texture of everything without changing the facts of anything. Teller had been discharged 8 days before her last shift. He had shaken her hand at the door of room 17, which he'd moved back into after the step-down stay, and held it for a moment longer than a handshake required. "You're not going to be here when I come back to see about the ribs," he said. "No," she said. "Where are you going?" "Somewhere that needs a floor nurse," she said. He looked at her. The almost smile, the one she'd first seen on the second night, made it all the way to an actual one this time. "Take care of the ribs," she said. "Calloway," he said. "Yeah." "For what it's worth," he said. "I knew from the first night." She looked at him. "In the elevator," he said. "When you saw Grant and your hand tightened on the chair. I knew then that you were someone who had been through something real." He paused. "I just didn't know what to do with it." "You stayed in the bed," she said. "I stayed in the bed," he said. She nodded. He picked up his discharge bag and walked out, and she watched him go with the specific feeling of watching someone who would be fine, which was the best outcome, which was the only outcome she had ever actually been working toward. On her last shift, Donna Presser stopped her in the corridor. It was 9 p.m., and the floor was in its nighttime rhythm, and Donna was where Donna always was, and for a moment they just stood in the corridor looking at each other. "I owe you an apology," Donna said. "For the first week. The break room." "You don't—" "I do," Donna said. "I decided what you were before I knew you. That's mine to own." Sera looked at her. Donna Presser, at 61, 22 years of a building, a woman who ran a floor with the authority of someone who had earned every millimeter of it. She had been wrong about Sera. She was willing to say so, plainly, without dressing it up. "I appreciate it," Sera said, and meant it. Donna nodded. "The nurses you trained this month. On the blast injury protocol and the decompression assessment." She paused. "Those are things they'll carry." "They're good," Sera said. "Petra especially." "I'll tell her you said so," Donna said, and then, "You're going somewhere that needs you." "Yes," Sera said. "Good," Donna said, simply. No ceremony. The way Donna said most things. She went back to the charge desk and Sera went to finish her last round. She cleaned out her locker at midnight. Not much to clean out. She had never been a person who accumulated things in institutional spaces, another habit from before that had carried forward. A pair of spare scrubs, a phone charger, a photo she'd kept taped inside the door, not of people, but of a landscape, A high ridge somewhere in the western part of the country, shot in early morning light with the kind of clarity that only exists at altitude. She had taken it on a hiking trip 3 years ago, in the first weeks after she'd left. She had kept it because it reminded her that there were places that existed outside institutional walls and operational structures, places that were simply what they were. She put it in her bag. She stood in the locker room for a moment. The fluorescent light buzzed. The building made the sounds it made at midnight, which she knew by now the way you know a language you've been living in. Not perfectly, but fluently. She thought about what the past 14 months had actually been. Not a hiding place. She had told herself it was a hiding place, and it had served that function for a while. But the truth she was willing to look at directly now was that you could not take everything she had done and everything she knew and everything she was made of and compress it into floor nursing and supply cart restocking and disappear into the background of an institution. Not because the work wasn't real. The work was real. Every shift of it. Every patient she'd checked on, and every vital she'd recorded, and every room 22 who needed someone to sit with them and explain something slowly. That was real, and it mattered, and she was not dismissing it. But she was not built for hiding. She was built for exactly the thing Ashford had described. Moving through the world in plain sight, seeing what other people missed, being the variable that no one had thought to account for. She had spent 3 years trying to file that down into something quieter, and what she had learned, at the cost of 14 months of mop buckets and condescension and the particular exhaustion of being invisible by choice, was that filing it down didn't make it smaller, it just made it weight. The people who thought she was nothing had handed her the conditions she needed to do everything. She was not grateful for the contempt. She was not going to package it into a lesson about how dismissal builds character, because that was the kind of narrative that served the people who dismissed you more than it served you. What she believed, standing in the locker room at midnight on her last shift, was something more specific and less comfortable. That the world has a long history of failing to see people clearly, and that the failure is the world's problem, not the unseen person's, and that what you did with being unseen was a choice that belonged entirely to you. She had chosen, for 3 years, to be unseen. She had chosen, on a January night when a helicopter came down hard outside an ER window, to be exactly what she was. Both choices had cost something. Neither one had been wrong. She shouldered the bag, hit the locker room light. Rourke was in the parking lot when she came out, leaning against a car with the patience of a man who had waited in worse places for longer periods of time. He had his hands in his jacket pockets, and he looked like what he was, a person who had chosen a life that asked more than most lives asked, and had kept choosing it. "You didn't have to come," she said. "I know," he said. She stopped in front of him. "The first deployment," she said, "with the new team. You said 6 months. Could be shorter," he said. "Depends on what we find." "It'll be longer," she said. "It always is." "Probably," he said. She nodded. "I need one thing from you," she said. "What?" "When I call, pick up," she said. He held her gaze. "I always pick up," he said. She got in her car. He stepped back. She pulled out of the Coastal Pines parking lot at 12:17 a.m. and drove through Fort Dillon, which was quiet at this hour, the streetlights running their steady amber in the winter dark, the roads belonging mostly to the people who work while the world sleeps. The truck drivers, the shift workers, the nurses going home, and the nurses heading in, the invisible infrastructure of every ordinary night. She drove until the town gave way to the open road, and then she drove some more, the landscape opening up around her, the darkness settling into the particular quality of darkness that exists between places rather than within them. She was not at peace exactly. Peace was a condition she was skeptical of in any sustained form, because the world she moved through was not organized around peace, and pretending otherwise was its own kind of damage. What she was clear. Clear about what she had done, what it had cost, what it had produced, and what she was heading toward. 4 men were alive because she had been in a hallway with a mop and a working knowledge of tension pneumothorax. A recall had been issued for 7 categories of military medical supply. A network had been dismantled. A man who had designed a system for killing people through the infrastructure meant to save them was in federal custody. None of it was clean. None of it was a story that resolved into simple lessons. The doctors who had handed her cleaning assignments had not all learned something profound. Some of them had just moved on. Voss was in administrative review and would probably land somewhere else eventually, carrying his particular combination of talent and blindness into a new institution. The world that had built Meridian was the same world she was driving through, and it would try to build something like it again. But she was going to be there when it did. Not on her knees with a mop, not invisible by design, waiting for the right moment, compressing herself into the space other people left when they failed to look carefully enough. She was going to be exactly what she was, where it was needed, with the authority to act. The road ran straight and dark ahead of her. She drove on. There is a particular kind of person the world consistently fails to see clearly, not because they are hidden, but because the world has decided in advance what they are, and having decided, stops looking. These people carry their full capacity into every room and set it aside because the room has already told them what their role is. They clean the floors. They carry the supplies. They stand at the edges of decisions they could make better than anyone else in the space. Most of them never get the moment she got. Most of them do the work anyway. Invisible, uncredited, carrying the weight of competence that nobody around them has thought to use. The nurse who knows what the doctor missed. The technician who sees the structural flaw. The person in the background who has been watching long enough to understand exactly what is happening and who has never been asked. This story belongs to all of them. Not because the ending always comes the way it came here, because it doesn't, and pretending otherwise would be its own kind of lie, but because the capacity is real regardless of whether the recognition comes. The knowledge does not diminish because no one asks for it. The years do not become nothing because they were spent in the margins. What you are does not require an audience. It only requires you to keep being it, even in the hallway, even with the mop, even in the long, quiet dark before anyone thinks to look.